audible and visible, please type yes in the chat box. Awesome, great. Thank you for letting me know, guys, that I'm audible and visible. How many of you want to live a disease-free life? Just type me in the chat box. How many of you want to understand core naturopathy? How many of you are fed up of medicines and supplements? How many of you want to know the real meaning of health? How many of you want to live 100 years or more? How many of you hate hospitals? Just type me in the chat box. Great. I'll keep the chat only visible to me because there are more than 1,000 people in the room. I don't want any distractions. If that is okay, just type okay in the chat box. It's going to be in English, 100% English. Great. So I'll keep the chat visible to me so that there's no distraction. Great. So, ladies and gentlemen, boys and girls, this is a 100-minute free webinar. Free things, people take it for granted. But in this webinar, if you want to understand how I have helped more than 20,000 people to come out of their lifestyle diseases, including cancers. So this 100-minute can be a game changer, right? So I want you to 100% focus so that you can understand what does it take to live a disease-free life. This session is called Naturopathy Healing System, right? So let's start. I hope you have a pen and a notepad in your hands. So I'll start from the core principles of naturopathy. So what are the top 6 core principles of naturopathy? So these are the 6 core principles of naturopathy. First, do no harm. क्यों? क्योंकि मैं दवाइयां नहीं दूंगा, supplements नहीं दूंगा, right? No medicines, no supplements. A to Z, any disease, naturopathy has the answer. Principle 2, the healing power of nature is huge, is amazing. When I was about to die in a hospital, I realized, oh my God, this is what nature can do. So it's powerful, but you need to understand. Principle 3, identify and treat the causes. Many of you might be swimming at a symptoms level. You saw something wrong in your blood reports and you're diagnosed as a patient or ab dawaiyan kha rahe ho, right? Principle 4 is nature as a teacher, right? We have so many teachers in life, school teacher, college teacher, so many teachers. Make nature one of your teacher, right? And you'll see the amazing results. Principle 5, treat the whole person. Now, the saddest thing, even the intelligent people, they are in this trap. I want to treat my heart. I want to treat my brain. I want to treat my arthritis. I want to treat this. You're not seeing yourself as a whole, right? You need to see yourself as a whole. And principle 6 is prevention is better than cure. A lot of people, they take action when the water has reached the nose level. A lot of people, they try to take shortcuts, right? So my submission is that you don't need medication. You need education, right? Education, right? So my only core message in this particular 100 minutes is that there is a life without drugs, disease, and diagnosis. एक जिंदगी है जिसमें आप you can live with freedom, without any fear. Yeah, I don't need any medicine. I don't need any blood work. I don't need any PET scan, CT scan, MRI. मैं ऐसे ही जिएगा 100 years. So if you want that kind of craziness, you're at the right place. Do I have your permission to talk about myself, who I am? Just type yes in the chat box if I have your permission to tell exactly who I am and why I'm here and what I'm going to do. Yeah, just type yes in the chat box. Thank you. Amazing. Okay, so my name is Vishal Saini. I am a professional cricketer turned a naturopath. Right? I was a professional cricketer turned a naturopath from 2007 to 2013. Right? I was having kidney stones, gallbladder stones. It was turning into a cancer. I was asked to remove my gallbladder. My parents' money was gone. My mother's boutique was about to be sold. My sister was sitting for marriage, and all the expenditure of my home was going in my treatment. Then one fine day, I said no. I just ran away from the hospital, and I did not know what to do. And starting naturopathy, I found some people. Since 2014 till now, I have helped 20,000 people to come out of their diseases. I have been certified by the President of India 23 times. So that's my small introduction. So in short, you can say me Vishal, right? So I'm doing this from last 10 years. And what I have done, I'll show you some case studies as we move forward in this session. Thank you. Why we need to be healthy? Simple question. Even a nursery school child would say that, yes, I want to be healthy. But what it takes to be healthy, right? Supplements, medicines, रेगुलर चेकअप, हॉस्पिटल में भर्ती, इंश्योरेंस है, ब्लड वर्क कराया, गोली खाई, मंडे ट्यूसडे वेडनेसडे, नो. We need to be healthy because we survive on two, we have a mindset of two things, survival and protection. Whatever you are doing in your life, अभी सुबह से लेकर रात तक अभी तक, whatever you have done, two things. because of survival and protection. But see the next slide. If you have a weak heart, you can leave the webinar. But if you have a strong heart, you want to know the reality, then be with me. See the next slide. 49% of the world diabetic is in India. If 1,000 people are diabetic in India, 490 is Indian. If 1,000 people are diabetic in world, 490 is Indian. Or 100 में से 49% is 49 is Indian. See the death rates that is happening because of heart problem. You remember how this guy died, Siddharth Shukla, Raju Srivastava, Satish Dhawan, Sushmita Sen got heart attack. I know more than 50 people, they were dancing, they were in gym and they collapsed. What happened different in the last 5 years, 2 years? What happened? ऐसा अचानक से क्या हो गया कि we are dying suddenly. People used to die from heart diseases, cardiac arrest. अभी अचानक से क्या हो गया? 2 साल 3 साल धार 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 उनको हार्ट अटैक आ गया, कार्डियक अरेस्ट आ गया. So what mistake you are making? Can you correct that? Life is beautiful. So don't die suddenly. That's my message. See that deaths that is happening because of cancer. World Health Organization says every 10th Indian will develop cancer, and out of every 15, one will die of a cancer disease. So we need to be like, अच्छा घर में कार है आपकी? Car, bike, home, good job, bank balance, good clothes and almirah, shoes. This all is temporary. This all is temporary, right? The biggest thing that you have is your health. If you're not born with a disease, you cannot live or die with that disease. ये माइंड में लॉक कर लो. If मैं किसी बीमारी के साथ पैदा नहीं हुआ, मैं उस बीमारी से ना तो जीऊंगा, उसके साथ ना मरूंगा. If you can understand this one small message in the next 100 minutes, sorted, boss. Life is excellent, right? 1 in 5 women have PCOD or PCOS problem. I have 12 साल की बच्चे in my clinic coming with their parents, PCOD. Right? Mother coming in my clinic saying, doctor said, please get married, otherwise she'll not be a mother. Age कितना है? 17 years. Why? She has PCOD. So you need to think from a deeper point of view कि boss ये चल क्या रहा है? Nearly every third Indian suffer from a thyroid disorder. And there are 8,000 diseases. I've just picked few. कितनी बीमारियां हैं? 8,000. मरने के कितने कारण? 8,000. There are 8,000 reasons to die. मैं बोल रहा हूं, just educate yourself. What you know about health is health industry or medical industry. मेरे supplement खा लो, मेरी दवा खा लो, मेरे से टेस्ट करा लो. That is medical industry. What I will talk today is medical science. ये दो अलग चीजें हैं, medical industry, medical science. I'll talk about medical science. I'll talk truth. Truth is bitter. Have water with you. Make sense? Good. 9 चीजों की बात करूंगा. I'll talk about 9 things. Types of patients. You will be in one category. Second, bricks of false belief that you have made regarding your diseases. मुझे दवाइयों पे रहना है, मुझे ऐसा करना है, मुझे टेस्ट कराने हैं बार बार. It's like a shackles. You're not living. A lot of people are not living this life. They're just dragging. So I'll break those false belief of yours. Then health expenditure. People make money, then they spend those money in their health. In 2018, 55 million Indians came below poverty line just to pay their hospital bills. Just to pay their hospital bills. So 55 million Indians. And they paid the hospital bills. 70% of the people did not live. Paisa gaya, jaan gayi. It was front page news in Times of India and Economic Times. Google it. What are the top 4 reasons of death worldwide and how you can be in the safe zone? Right? Drug mechanism. मुझे बुखार हुआ, I eat a medicine. My glucose is high, I eat a medicine. My BP is high, I eat a medicine. Period is not coming, I'll eat a medicine. This is the first one part of the coin. What medicine does inside, what supplements does inside, आज बताओ, right? Because I've taken it for 7-8 years and listen with a broad mind, not with a mindset कि which pathy is महान, allopathy or homeopathy or ayurveda or यूनानी और सिद्धा, अभी naturopathy लेके आ गया. Listen with a very open mind कि मैं क्या बोल रहा हूँ, right? And probably this is my last free webinar, no replay, no recordings. Lessons I learned from Indian Army. The proudest moment for me, a letter comes to my home and my dad gives me this letter to me. Oh, I have to speak for Indian Army. I have to go give them training. So I teach Indian Army Indian Navy and Indian Air Force. How many sessions I have done with them? 6 sessions. I'll show you the photograph. What I learned from them, I'll show you. Right? I'll tell you what I learned from them. मैं सिखाने गया था, बस सीख के आ गया. Lessons I learned from Bollywood celebrities. Right? More than 15 core Bollywood celebrities are in this community called GoNature, and more than 20 IPL players are in this community called GoNature. Right? So you will be a part of this. Then I'll be talking about the one word treatment which has been accepted by homeopathy, allopathy, Unani. What is that one word? Right? I'll be talking about that. And last but not the least, what is the future of humanity? We are not the same human beings like your great grandfathers were. We are not the same human beings. We are over medicated. We are over vaccinated. We are over antibiotic given. We are not the same human beings. हम लोग दिखने में वैसे ही हैं, स्किन है, चेहरा है, हाइट है, but from inside we are very different human beings now, right? So how you can become the same human being, right? This is a question mark. कि कैसे बनना है? Because a lot of you think humans 1,000 years back today same. No, not same, right? So you have to understand that these 9 things can give you a big message today, and you have to take out those message. How many of you have a notepad and a pen in your hands? Just type me in the chat box. Pen और notepad है आपके पास? Just type me in the chat box if you have. Perfect. सबके पास है? Good. me लिखिए. Your energy, my energy मैच करेंगे. Perfect, perfect, perfect. सबके पास notepad है, pen है, पानी का bottle है. Good. Now, this is the message I want to give you. Right? This is the message I want to give you, and you have to have that awareness. See this photograph. Just see this photograph for 5 seconds. और सोचो इससे क्या story बन सकती है. See this photograph for 5 seconds and think what story you can make from this. I'm giving you a hint. The person is driving rashly on the cliff of a mountain. ये शख्स बहुत खराब गाड़ी चला रहा है and just on the edge of a mountain. So what advice you'll give? भाई, please come in the safe zone. तुम्हारे माता पिता भाई बहन बिल्कुल गाड़ी में बैठे हैं, तुम भी जाओगे वो भी जाएंगे, right? So the message is very clear. The message I want to give you is that those who are on medication, those who are on supplements, those who have the kida of getting their diagnosis test every time, they are on the edge of life and death, right? I'll prove you this. And there is a better solution waiting for you. It's called alternative medicine in a country in which we have Ministry of Ayush. So ladies and gentlemen, the message in this session I'm going to give you is that drive safely. In this game of life, drive safely. Medicines, supplements, over diagnosis से कुछ नहीं हासिल हो किसी को. Emergency, fine. Now, understand there are 2 types of people. आप में कोई भी इस webinar में there are 2 types of people. One who eats medicines and one who does not eat medicines. As simple as that, right? One who eats medicines, इसमें add that category also who's eating supplements. मेरा iron तो कम नहीं हो गया, मेरा vitamin तो कम नहीं हो गई, before gym, during gym, after gym, right? Many of you might be getting results also, and many of you are selling supplements. Keep doing that. अगर बेच रहे हो, लक्ष्मी आ रही है, keep doing that. But what I'm trying to say is that there are 2 categories, one who eats medicines and supplements and one who does not. In this category, there are 2 subcategories. Lot of people are not bothered. I know in my community, there was a guy who was eating 25 tablets in a day. 25 tablets in a day. It's like, okay, हाँ, खा रहा हूँ. Breast removed, knee replacement done, kidney transfusion done, jeep card दी. And they're like, okay. A lot of people like that. इंडिया में 9 crore diabetic, एक मैं भी खा लूंगा, क्या फर्क पड़ता है? So a lot of people in the category are not bothered. but चल रहा है, right? And a lot of people who are bothered, but they're not finding the alternatives. करना क्या है? I've been to Himalayas, I've done this, I've done that, Google diet, this diet, Sattvic diet, सब. But end of the day, I'm on medicines. So this session is for both the categories. 100 मिनट दो, बलबोन होगा, शायद जीना सीख जाओ naturopathy के थ्रू. Now, when I started my clinic in 2014, these were the questions coming. Boss Vishal, my disease is incurable. I've tried everything. I have a genetic tendency, Vishal. My father died of cancer. My grandfather also died of cancer. Maybe I'll also die of cancer. So this person is dead before cancer. Bhai, fear. हो गया तो, right? Statistics. 2040, half of the India would be diabetic. Some studies show that. Then quitting drugs is dangerous. दवाइयां छोड़ना dangerous है. And this 34-year-old boy is teaching the world to come out of medication. So my talks will look like an alien. कितने लोगों को जानते हो? How many people you know who have said to you that you can come out of your medication? How many people you know who will say to you, you can come out of your diseases? No. You will see people putting you on medication. You will see people putting you on supplements, right? You will see people putting on Vestige, Herbalife, Mera wala khalo, you, right? But how many people will say to you, ki boss, you don't need supplements, you don't need medicines, फालतू में diagnosis मत करा, and you can come out of a medication. And any person saying you like this, I will like, पागल, ऐसे कैसे होता है? This is the trap. हमें ये प्रोग्राम किया गया कि पहले ब्लड टेस्ट कराओ, मशीन में घुस जाओ, एक रिपोर्ट आएगी, उस रिपोर्ट के पैरामीटर्स विल डिसाइड समथिंग. So I will be very crystal clear about you, about all the things I want to teach today with evidence. Then there's a category of people वो दुखी आत्मा लोग, like, सब जगह मिलावट है, खाएं तो खाएं क्या, right? Blamers, complainers always. Then failing to meet medical expenses and taking shortcuts, ऐसे लोग भी हैं, right? Then the question, routine checkup and screening. See, sometimes you need to believe, you need to understand that routine checkup fine, blood reports में क्या है, ठीक है, कराओ check, जितना कराने कराओ. But the frequency of MRIs, ultrasound, PET scan, falana, dhimkana, we fail to understand that it gives us electromagnetic fields. This is an EMF tester in my hand. एक EMF tester is in my hand. You see? Now it's showing 26 blue zone. If I come close to my desktop, अब देखो ये बढ़ेगा धीरे धीरे. It's increasing. अरे बाप रे, 58, 60, 70, right? 100. Or again 120, 130, 150. If you sit in this for on 300 pay, if you sit for like 1 hour, 2 hours, you will end up as a depression patient. And just imagine in your home, you, your parents, your children, सोचो किसी का 6 महीने का बच्चा हो, 1 साल का बच्चा हो, they are in this 24/7 into 365. Why? Because of the mobile towers. This mobile phone in your hands, in your pockets. Right? So people not understanding दुश्मन कौन है हमारा, it invisible दुश्मन है, right? How many of you are understanding? Just type yes in the chat box what I'm saying. Yeah, just type yes in the chat box. Cool, perfect. Right? So the दुश्मन जो है हमारे, that is invisible. आपको पता ही नहीं है तो ये सब क्या है, right? कैसी बातें कर रहे हैं करता, right? So all you have to understand कि आज समझो कि problem is not what you see. Your enemy is invisible and you don't know that. अब एग्जाम्पल के तौर पे लेट्स से देयर इज अ मदर हु इज प्रेग्नेंट, गो टू अ गायनी सेज अल्ट्रासाउंड. नाउ आई हैव सीन women in my community when I was talking to them that before giving a birth, before she went through 6 ultrasounds. Now people fail to understand कि अल्ट्रासाउंड में this electromagnetic fields are so high. अब वो बच्चे पे जा रहा है, ऑटिज्म होगा या टाइप 1 डायबिटीज, थैलेसीमिया, ब्लड कैंसर, वो वक्त बताएगा. Right? So we live in a world जहां it's like mines बिछा दी हैं जगह जगह, आपको बच के निकलना है. And you don't know that कि where is that mine. Your phone is a mine, is diagnosis is a mine. So we fail to connect the entire picture. Right? So eventually what I'm trying to say is that कि boss, nobody can get ill. मैडम सर, आप जिस वेबिनार में जो लोग बैठे हैं, you cannot get ill. It's impossible. Next to impossible. कभी सुना घोड़ा, horse saying I have to put a stent in my heart. So these things happen only with humans. So what I'm trying to say is that you're not ill. You are actually confused. Just type C in the chat box if you're confused. Which diet to take, which pathy to follow, homeopathy, allopathy, Ayurveda, Unani, Siddha, right? Which coach to follow. So people are confused. If you are somebody who's confused, just type C in the chat box. Perfect. And a lot of you are like in the C category. खुल के लिखो, see, just give a message to the universe. Yes, मैं confused हूँ, मुझे रास्ता दिखाओ boss. I don't believe in accidents. You are here because you saw my ad, because somewhere you manifested कि भाई कुछ natural therapy से कुछ मुझे पता, I want to learn something natural. That's why you saw my ad. That's why you are here. You manifested that. It's not an accident. Yeah, makes sense? Just type MSS if it is making sense to you. This is what you manifested. आप कुछ ऐसा ही सोच रहे थे या ढूंढ रहे थे, right? Good. आगे चलते हैं. So you are confused and my objective is to bring you out of this confusion. When I move forward in this session, I'm going to give you some gifts that will help you for lifetime. पहला गिफ्ट, आई टॉक अबाउट योर ब्रेन, राइट? टारगेट 100 मॉडल ऑफ द ब्रेन. वी आर एक्चुअली स्लेव्स, वी आर मॉडर्न स्लेव्स. मैं था, अब नहीं हूं. यू माइट बी राइट नाउ अ मॉडर्न स्लेव. आई गिव एन एग्जांपल. सारे ध्यान देंगे. हियर, आफ्टर दिस सेशन, इस सेशन के बाद, व्हाट यू कैन डू, eat your dinner. Let's say you eat 3 chapatis. Today you eat 6 chapatis. Overeating, do it overeating. After doing your overeating, just go and sit in McDonald's or KFC or Domino's. बैठ जा, बस बैठना है. In 10 to 15 minutes, you will say, भैया एक बर्गर लाना या एक पिज्जा लाना, because the ingredients are designed in such a way कि आप सूंघ हो, you smell that, and your pineal gland will say, release a hormone called ghrelin, and you will end up eating despite you are overeating. आपको भूख लगाई. किसी अंधे इंसान को if we put those ingredients किसी गोबर में डाल के दे, मिक्स कर दो और वो खाए गोबर, तो मजा आ गया साहब, क्या बनाया आपने? इट वाज गोबर, बट द इंग्रेडिएंट्स मेड हिम स्लेव. So now your mind is not able to make that right decision about food, about life, about health, about wealth, about relationship. And you're looking for therapies, dietitian, nutritionists, doctors. कोई जादू की छड़ी घूमेगी और मैं शक्तिमान बन जाऊंगी. It is all illusion. Making sense? Just type MSS if it is making sense to you. तो इस पे हम, it's going to be deep. छोटा मोटा बात नहीं करूंगा. I'll talk something which you have never heard, which you have never seen. अच्छा, ऐसा भी होता है. Okay, now, thank you, thank you. I just kept the chat visible to me, guys. A lot of people, they feel disturbed. So now, target 100 model of the brain. It means your brain has some tools to protect you. आपके ब्रेन के पास there are certain tools to protect you. जैसे दुश्मन को मारना है तो गन है, पिस्टल है, राइफल है, मिसाइल है, तीर कमान है, गुलेल है. So brain has certain tools to protect you. So we'll be talking about those tools. Now, next I'll be talking about blueprint of human anatomy. ये इंसान का शरीर काम कैसे करता है, राइट? खाया पिया, नेक्स्ट डे you get empty. No, it's a little deeper. There's one anatomy, इतना मोटा किताब, medical people has to read, and there is one more anatomy, it's called common sense. I'll be talking about the common sense वाला human anatomy today. And then I'll be giving you membership of my Facebook community. आप आ जाना उसमें. I keep posting a lot of things over there. And 2 special bonuses. 20 incompatible food list. If you mix them and you eat, your body high chances will become more acidic. और डिजीज कहाँ पे आता है? When the body is acidic. So what is this 20 food list? ये मेरे से ले लेना जाने से पहले. And 5 animals like habit to adopt. If I forget last में आपको देना, मुझे याद दिला देना. Just make me remind कि हाँ भाई ये दो लिस्ट दो मेरे को. Great. Now I'm starting the session. I don't sell supplements. I'm not into networking marketing. I'm not promoting any physical product. And yet I'm very satisfied with my bank balance. Right? So what I do, I teach people to live a healthy life without touching supplements, medicines. Cool. Now, let's start from your disease. Tell me the chat box. Please tell me the chat box what disease you have. लिखो. मैं ही देख रहा हूं तो खुल के लिखो. Diabetes, thyroid, sugar, diabetes, thyroid, lump of fat, vitiligo, PCOS, anxiety disorder, alcoholism, disturbed sleep, anxiety, PCOS, rheumatoid arthritis, sexual problem, PCOD, fat increase, thyroid, nerve issue, arthritis, high cholesterol, मम्मा को arthritis है, hemoglobin from 7 to 10, thyroid, overweight, facial growth, endometriosis, anxiety, PCOD, sugar, gastric trouble, back pain, celiac disease, HbA1c high, autoimmune, platelets low, osteoporosis. बस कोई धांसू नहीं है कैंसर वैंसर वाला. डिप्रेशन, वेरिकोज वेन्स, गैस्ट्राइटिस. और बताओ क्या सीखना है, जल्दी बताओ. अपना बताना, ये नहीं पूरे आप कॉलोनी का बता दो. विटामिन डी, विटामिन B12 deficiency, indigestion, arthritis, B12, anxiety. चलो sorted. Full stop. Heel pain. Full stop now. Full stop. Now sugar, allergy, headache. Okay. Recovered from breast cancer. Good. Recovered from breast cancer. Good. Chalo, Shanti. Now, these are just disease names, right? Like I am Vishal, I did not kept my name Vishal. Thyroid. किसी ने तो नाम, somebody must have kept this name thyroid. Alzheimer, such a beautiful name, Alzheimer. Parkinson, such a beautiful name. I thought Parkinson is something related to going to park, but it's a disease. So I'm saying 8,000 diseases are there. Somebody has kept these names. Your diabetes, your thyroid, your varicose veins, your PCOD, your falana, your dimgana. I'm saying keep these disease names aside, right? Let's talk about uh, something which is like the root cause. Okay. Now see how your journey started. Everybody in the room. कुछ discomfort, disease. Disease कोई बीमारी नहीं है. Disease, it's disease. Your body was not at ease. It can be anything. Appointment, diagnosis. In diagnosis, something wrong. Second appointment, and you're on medication for life. Then regularly you have to get your consultations, appointment, checkup, right? Then you have to be on a certain diet, ये नहीं खाओ, वो नहीं खाओ. Then sometimes it can be hospital emergencies. So for that you have your insurance and use so many different health apps. Survival, protection. Starting बोला था. तो ये आप क्यों कर रहे हो efforts? Survive करना है, protect रखना है. अपने आप को, अपने परिवार, right? So these are the two things you are working on: survival and protection. Survival and protection. That's why you're putting these efforts. Now there's next level people, right? The next level people who are putting extra effort. Yoga, pranayama, 4 a.m. club, 5 a.m. club. Good. Very good. But did you come out of your diseases? Right? Then, uh, retreats, uh, club membership, Lions Club, Falana Sports Club. We all are educated. So many supplements, boss. Go to gym. वहाँ पे भाई साहब खड़े होंगे 6 packs लेके, वो आपको ज्ञान देंगे कि eat this supplement, eat that supplement. Books, e-books, medical journals, trainers, coaches, diet. By the way, there are 3 million diets on this planet Earth. अगर आप इच्छुक है जानने के लिए दुनिया में कितनी डाइट्स हैं, हाउ मेनी 3 million डाइट्स. So how many of you are putting some efforts in these categories? Just type me in the chat box, right? Or your family members putting some efforts, just type F. Me, F, me, F, me, F, me, right? So you are putting these efforts, right? My question to you, सीधा जवाब, are you out of your medication? Just type yes or no. Are you out of your disease? Just type yes or no. No, 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 no. Yes, yes, yes. No, no, no. Yes, no, 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 no. Yes, no, no, no. Good. So majority I can see no. So what I'm saying, the efforts you are putting after spending so much money, still you are on diseases. I would like to give 0 to all the efforts you are putting. 0 दे दो. मैं सुबह उठता हूँ, I did not smoke, I'm a sattvic eater, I'm very spiritual person, मुझे कैंसर हो गया, राइट? तो ये विक्टिम वाला गेम अब हटाओ, अब दिमाग से गेम खेलो. Put all these 0 aside and just put 1 in front of these zeros. The value of your efforts will increase. Or put $1 in front of these zeros. So this one in dollar is awareness and insights. Awareness in insights. If we were able to help more than 15,000 people in COVID, it was awareness and insights. How you can do it yourself. Very simple. Ask why before how. Why should I do this medicine? Why should I do the CT scan? Why should I go with PET scan? Why should I go with chemo? So ladies and gentlemen, I'm saying put your disease name aside and just focus on one word. Today, first time you will come to know what disease you have. अभी तक आप लोग को था कि मुझे थायराइड है, मुझे कैंसर है, मुझे बीपी है, मुझे हार्ट है, मुझे वेरिकोज वेन्स है, मुझे पीसीओडी है. You were living with this tag. The first time you will come to know what is that you have to work. You have to work on your energy. Now, what is energy? You can give me beautiful answers. Energy is my aura. Energy is my vibes. पूरा अंग्रेजी टॉपिक डिक्शनरी खोल दोगे यहाँ पे. I'll give you a very practical answer. Morning school time assembly. One or the other student used to get faint. Assembly time. Then that student was taken to the sick room. सिक रूम में देयर वाज अ ग्लूकोन डी का डब्बा, ग्लूकोन डी, हरे रंग का डब्बा, that was given to the student and the student revived. How many of you remember? Just type R in the chat box. You remember that? Yeah, maybe this happened with you. मेरे साथ हुआ था, I remember. I went to the sick room, right? One madam came, the caretaker of the sick room, glucon D, and I was revived. So what happened? Glucon D, glucose went to my blood. So ladies and gentlemen, what I'm trying to say, energy is glucose in your blood. Now let's say this is a glucometer. It is showing 140 reading. It drops down to 100, 80, 60, 50, 30, 20. I'll die. So energy is glucose and glucose is energy. Now, when you know energy is glucose and glucose is energy, now your job is to put the hammer at the right place. Right? Means आपकी साइकिल की चेन उतर गई थी. Your cycle chain came down and 20 people are standing. Chain उतर गई आप. So at what direction was your pedal when the chain came out? What was the velocity of your pedal? In which direction the air was going? You made your health like that. I am saying, chain पिछली chain उतारो, ऊपर लाओ, and you can do it yourself. Are you understanding what I'm trying to say? Just type yes in the chat box. You guys have made your health complicated yourself. ब्लड टेस्ट हुआ कि नहीं, सप्लीमेंट्स खाए कि नहीं, टेस्ट कराया कि नहीं, इंश्योरेंस है कि नहीं, यू मेकिंग इट कॉम्प्लिकेटेड. एक यूएसए से साहब आएंगे, वो बताएंगे कि क्या प्रॉब्लम है आपको, राइट? व्हाट आई एम ट्राइंग टू से, कीप इट सिंपल. नाउ टुडे फर्स्ट टाइम यू विल कम टू नो व्हाट डिजीज यू हैव. टुडे फर्स्ट टाइम आपको पता चलेगा कि व्हाट डिजीज यू हैव. बिकॉज राइट टिल टुडे यू आर लिविंग कि मुझे थायराइड है, मुझे बीपी है, मुझे कैंसर है. यू ऑल आर डायबिटिक. कहा बोल रहे हो बेटे? नो, आई डोंट हैव ग्लूकोज, माय ग्लूकोज इज नॉर्मल. यू ऑल आर डायबिटिक. अभी सभी बुद्धिजीवी आएंगे एंड दे विल से नो, माय ग्लूकोज आर नॉर्मल. आई एम ओबीज बट माय ग्लूकोज इज नॉर्मल विशाल. मुझे थायराइड है बट मैं ग्लूकोज कभी हाई नहीं हुआ. I have varicose veins, I have PCOD, I have this, I have that, but I have my glucose. This is the trap. And even the educated people are in this trap. कि मैं बीपी, मैं कैंसर, मैं आई साइड, मेरी हड्डियां खराब, मेरा ये. The day you started differentiating, that day the health of humans went down. You all are diabetic, and I'm going to prove this in the next 15 minutes. You all are diabetic. Let me prove. What is diabetes? If you know, very good. If you don't know, very, very good. I'll make it very easy. This is diabetes. जिसको नहीं पता. Empty stomach, if you check your glucose, if it is 100 or above, आपका sugar level, it is 100 or above, you're diabetic. If it is 140 after eating your meals, 8 a.m., let's say you have your breakfast, 10 a.m., after 2 hours you check, if it is 140 or above, you are diabetic. The third parameter is HbA1c. It was born in 2010. Before that, nobody knew what is HbA1c. So these three parameters are correct, right? Now let me explain you what is diabetes in naturopathy. For that, I want to teach you target 100 model of the brain, right? For that, I need to teach you what are the weapons of the brain. कैसे बचना है, अपने को कैसे बचाना है in a world who believes in medicines and surgeries and stuff like that. Now understand. एक लंबा सांस लो. Have a water bottle, have a sip of water. Understand. Now let's say if I check my glucose right now, मान लो if I check my glucose, अभी check करता हूँ, let's say for example, and the reading comes 300. It means I'm diabetic. Whether it is fasting or PP, change so glucose, बाप रे, I'm diabetic. Who decided I'm diabetic? Not you, not me, not my doctor साहब. This छोटा सा glucometer is deciding I'm diabetic. This number is actually deciding कि मैं diabetic. What is the science of this number? इस 300 का मतलब क्या है? 400 का मतलब, what does this 300 means, 400 means, 275 means, what does it mean? ये समझ गए, sorted. जीवन easy. Now let's understand what does this 300 mean. My name is Vishal Saini. My age is 34. I'm a cricketer turned naturopath. My height is 5 feet 9 inches. I live in a city called Agra, basically from Punjab. My height is 5 feet 9 inches. In my body, how much blood I have? 4 liters. एक rough idea. In my body, I have around 4 liters of blood. It can be 4.5, it can be 5. 4 bottles है मेरे पास, इसलिए मैं बोला 4 मान. I want to take out blood of my body and put in this bottle. So 1 liter blood will come in this bottle. ठीक है? तो मैं आपको लाइव डाल के दिखाता हूँ. मजाक कर रहा हूँ. So my body's 1 liter blood will come in this bottle. Cool. Second liter blood can come in this bottle, and the remaining 2 liters blood can come in this bottle. So total 4 liter blood can come in these 4 bottles. Got it? Now, glucometer is showing कि my reading is 300. मान लेते हैं glucometer दिखा रहा है कि reading is 300. What does this 300 mean? ये गेम समझो प्यारे. 300 means in my 1 liter blood. 300 means in my 1 liter blood, I have 3 grams of glucose. If my reading was 400, it means in my 1 liter blood, I had 4 grams of glucose. If my reading was 250, 2.5 grams in 1 liter. बात समझ में आई? Just type yes in the chat box, तभी आगे बढ़ूंगा. बात समझ में आई? Please type yes. हाथ चलाओ जरा. Right? Yes or no? Yes, 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 yes. Good. So your Padosi reading is coming 300. So your Padosi 1 liter blood has 3 grams glucose. Okay. Now if in 1 liter it is 3 grams, how much in 4 liters? किसकी गणित अच्छी है यहाँ पे? कौन है जिसका मैथ अच्छा है? In 1 liter 3 grams. In 4 liters how much? Dipali, Riya says 12 gram. Shubham, Venkatesh 12, 12, Suparna 12. Well done. Good. Vijaya, Sakshi, everybody saying 12 gram. Right? If in 1 liter it is 3 gram, then 4, 3, 6, 9, 12. Simple. मगर brain क्या बोलता है? What does brain say? See the slide. Brain says this. Target 100 model. Means 100 reading आना चाहिए. Your reading should come 100. 100 means in 1 liter 1 gram. चलो brain says 50% up and down is fine. So brain says in 1 liter it should be 1 gram. Glucose, चीनी, sugar, carbohydrate, जो भी आपको नाम देना है दे दो. Right? But mine is 3 grams. So 2 gram is extra, na? So if in 1 liter 2 gram is extra, then 4 liters 2, 4, 6, 8. Out of 12 gram, 8 gram glucose is extra. बात समझ में आई? देखिए yes अगर बात समझ में आई. If you understood, just type yes. Right? Perfect. Right? So in 1 liter it should be 1 gram, minus 3 gram, 2 gram is extra. So I have 4 liters of blood. So total 12 gram glucose, 8 gram is extra. Simple. सबको समझ में आया? Good. बच्चा समझ जाएगा. First का बच्चा समझ जाएगा. I repeat. 300 reading means in 1 liter 3 gram glucose. Brain says 1 होना चाहिए. Right? 1 gram. Minus 3 grams. So 2 gram is extra. But I have 4 liters of blood. So 2, 4, 6, 8. Out of 12 gram, 8 gram is extra. This 8 grams is killing human beings. And you don't know that. 8 gram ने इंसानों को मारा. Now you say a cardiac arrest, respiratory failure, cancer last stage, whatever name you have to give, you can give. And I prove you this. This 8 gram is killing people, and people are busy making money. People are busy, for, फालतू की things. Health भूल गए हो. Now this 8 gram, before it kills me, my brain will take out a tool to protect me. And those collection of tools is called target 100 model of the brain. तो पहला टूल ब्रेन का निकालते हैं. Are you ready, guys? Just type yes in the chat box. Right? Let's take out the first tool of the brain. Perfect. Now, brain saw the khatra, 8 gram extra glucose. No. Let me do something. So brain is taking out the first tool. Understand the first tool. You see this blood vessels? नसें दिख रही हैं आपको? Green नसें. Right? पूरी body में सबके. If I take out all my blood vessels, arteries, then smaller than blood vessels is veins, smaller than veins is capillaries. It has some blood vessels, but you can say blood vessels, arteries, veins, and capillaries. If I try to take out all the blood vessels, arteries, veins, and capillaries of my body, so क्या होगा? If I make a single rope of blood vessels, arteries, veins, and capillaries, that rope will become so big that it will cover Earth's 2.5 round. पृथ्वी का 2.5 चक्कर. Can you imagine that? Everybody write down wow in the chat box. This is your beautiful bodies. Everybody write down wow in the chat box. This is your beautiful bodies. Right? Google it later. In your body, blood vessels, arteries, veins, and capillaries put together, Earth's 2.5 round. Capillaries alone is 2,000 crore capillaries. 2,000 crore capillaries in आपकी body. Now, pen निकालो, make some notes. अगर you don't want to forget my teachings. Let's give a name to these blood vessels. Write down in your notepad, blood vessels is equal to highway. जैसे सड़क होती है, highways. दिल्ली आगरा, दिल्ली मथुरा, दिल्ली एक्सप्रेसवे, लखनऊ एक्सप्रेसवे, आगरा मुंबई. So blood vessels is equal to highway. पतली सड़क, चौड़ी सड़क, whatever. Blood vessels is equal to highway. Inside the blood vessels, what do we have? Inside the blood vessels, what do we have? Inside the blood vessels, we have blood. लिखो, blood is equal to truck. T-R-U-C-K, truck. So blood vessels is arteries, veins, capillaries, highway, right? And blood is truck. In that truck, there should be some mal. Means in that blood, there should be some glucose. कितना? 1 liter, 1 gram. Minus 1 liter, 3 gram. 8 gram extra. तो ये तो खतरनाक है. So brain will say, no, this is 8 gram is not good, extra. Right? Glycemic index, glycemic load ज़्यादा हो गया boss. Now brain to protect me क्या करेगा? Brain एक message भेजेगा. Brain will send a signal to the truck. Brain will send a signal to the blood truck कि Mr. Blood, 8 gram extra glucose which you are carrying with you, very dangerous. Glycemic load, फेंक दो. Means brain is giving instruction to the truck driver, to the truck, कि extra सामान फेंक दो. So brain is giving instruction to the blood, extra glucose, drop it. Where? Highway. What is highway? Blood vessels. That 8 gram extra glucose is been now thrown in your blood vessels. Arteries, veins, capillaries. फेंक दो. I'm using one word, blood vessels. Blood vessels means blood vessels, arteries, veins, and capillaries. So चारों का मतलब blood vessels में बोल रहा हूँ, right? So that extra glucose has been dropped in your blood vessels, and your blood vessels, they become sugar coated, right? Chip chip हो गया वो, sugar coated. Or you can say earlier it was elastic, now they are plastic. So earlier your blood vessels were like this. देखो ये देखो सारे देखो, elastic. And now your blood vessel is like this, plastic. When this will happen, these people will become patient of hypertension, high BP. What is blood pressure? The force of blood which is touching your blood vessels. ऊपर वाला नीचे वाला, systolic, diastolic, systolic, diastolic. Who is deciding your blood pressure? Your heart, right? My voice is coming 100% clear. Just type yes if it is coming 100% clear. मुझे बीच बीच में अचानक. Good, thank you. So who is deciding your blood pressure? Your heart. धक, blood फेंका. Systolic, diastolic. धक, blood pressure. Systolic, diastolic. Now earlier when your blood vessels were elastic, blood used to come like this and it used to come back. It's elastic. Now it is plastic. It will come and it will go with speed because it's plastic, tight. Like there's a ball in my hand. If I throw on the wall, it will come back. If I throw on a mattress, it will not come back. So now these people will become hypertension patients. बात समझ में आ रही है? Just type yes if you're understanding. I'm just trying to make it as simple as possible. I'll come to more than 2,000 diseases. Don't worry. Right? Now this person will panic. Right? वो यहाँ पे लगाया. It's getting tight. So what is monitoring? Ta, 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 ta. Systolic, diastolic. और ये बाप रे, 180/100. Panic. Now this person will eat a BP की गोली. क्या तुम लोग पढ़े लिखे हो क्या भाई? Don't you ask, what is this goli that I'm eating that will make my BP normal? How? Ask how. Sorry, ask why. What did this BP goli did that the BP became normal? Who is deciding your blood pressure? Your heart. When somebody is BP ki goli, it goes and weaken your heart. Heart को weak कर दे. So before BP medication, your heart was dhak, dhak, dhak. The moment somebody starts eating BP medication, the heart is weak. Dhak, dhak, dhak. And when you check, it's normal. Did you address the root cause? Did you make your blood vessels hard? No, they're still hard. You just weaken your heart. Prove me wrong, I'll put a lock in my clinic. Now this person is eating BP medication. Lifetime खाना नहीं खाया तो कुछ हो जाएगा. Fear, business of fear. This person is eating medication for lifetime. Every time he pops in a BP medication, the heart is getting weak. And there is no surprise if I give you a data, all the BP eating patients, within a few years, the heart medicine also starts. With an angiography, angioplasty, open heart, this and that. Now, brain is watching the entire tamasha. Brain is watching the entire tamasha. Brain does not want that you became a BP patient or diabetic or heart patient. Brain does not want that. Right? एक एक पॉइंट लिखो. अगर मैं गलत हूं, मिनिस्ट्री ऑफ आयुष में एक कंप्लेंट लिख दो कि भाई एक विशाल सैनी नाम का ये ऐसे बता रहा है. आई विल गिव यू एनी प्रूफ यू वांट. Just use your logic. This is how the BP comes normal. Right? Now, there are few other factors. This is the main factor. Heart weak, BP is normal. Right? Now, what you have to do, brain says, okay, this tool is failed. Let me take out the second tool to protect Vishal Singh. Right? Now, what is the second tool? First tool, drop the extra glucose, but it became hard, BP patient. Right? And many of you are eating, your parents may be eating, senior citizens may be eating. तो छोटे छोटे 25-25 साल के लड़के खा रहे हैं बीपी की गोलियां. भगवान सद्बुद्धि देना उनको. Now, brain says, okay, let me take out the second tool. What is the second tool? Now, this time, brain will send signal to the truck, that is blood, कि Mr. Blood, don't drop the extra glucose. मत फेंको भैया, मर जाएंगे विशाल सिंह. Like Raju Srivastava and Siddharth Shukla and Palana Dimkana, all these celebrities. Don't do that. क्या करना है फिर? Now, brain says to blood, don't drop the extra glucose in the blood vessels. Throw in different organs of Vishal Singh. Throw in different organs of Vishal Singh. Now, my organs, your organs, means our body is made of cells. How many cells? 70 trillion cells, 80 trillion, maybe if you're 6 feet tall, 90 trillion cells. So, brain is giving instructions to the blood कि भैया वो transport कर दो extra glucose. 8 gram extra ना? 1 gram put it in the brain, 1 gram in the kidney, 1 gram in the pancreas. Just put it over there, throw it. But don't throw in the blood vessels, just throw it in the cells. Blood is a transporter. And this is the job which it has got. ये नौकरी मिल गई उसको. Now, that 8 gram extra glucose is being sent to different organs. 1 gram brain के cells में डाल दो, 1 gram heart में डाल दो, 1 gram kidney में डाल दो, 1 gram pancreas में डाल दो, liver में डाल दो. It's like that game has started. Now, how it goes, ये देखिए कैसे होता है. Now, let's say this is the cell. How many cells you have? Let's say you have 70 trillion cells in your body. This is one cell. Now, brain is saying, don't put in the blood vessels, throw glucose in the cells. Now, glucose will come floating in your blood. It will say, knock, knock. Cells will open. And the glucose will go. And how many cells are like this? 70 trillion. So all these cells are opening and the glucose is going inside. Problem solved. Nobody can get ill. आप बीमारी नहीं पड़ सकते. Eat, start eating 5 kg gulab jamun from tomorrow. But there is a loophole. Sometimes what happens, glucose comes, it says knock knock, but the cells does not open. अरे खोलो भाई, brain ने बोला है, it is not open. Or let's say you have 70 trillion cells, 35 are opening, 35 trillion are not opening. Glucose, खोलो, it's not opening. Why? Because these cells, they open with a key. They open with a key. And the name of that key is insulin. The name of the cat key is, लिख लो, insulin. It means if the cells are not opening, your body is producing no insulin or less insulin. Brain is getting frustrated. When I have told to open the cells, why they're not opening? Sir, because insulin is less. Who is making insulin? So a lot of you think that your pancreas is making insulin. फिर गलत पढ़ाई, स्कूल कॉलेज में गलत पढ़ाई. Pancreas is not making insulin. It's half truth. Pancreas is a factory. It's like organ in your body. Pancreas is a factory. In that factory, one labor is working. एक मजदूर काम कर रहा है. And the name of that labor is beta cells. Beta cells. Beta cells is making insulin. तो ब्रेन क्या करता है? Brain quickly sends signals to the beta cells कि please start making extra insulin. Why? Because the cells are not opening, the glucose will keep floating in the blood, which is more dangerous. So your beta cells start making insulin. All the 70 trillion cells will open, problem sorted. Again, there is a loophole. This loophole is killing people. Would you like to know that loophole? Just type BIO in the chat box. Bring it on. What is that loophole? If the session is going interesting, just type I also in the chat box. I means interesting. Perfect. Now the loophole is that, by the way, last 20 minutes, no slide, and still you are liking this. So that's called that you're interested in your health. It shows that you're interested in your health. Okay. So quick revision. This is what I told you. And then I said there's a loophole. Means while using all the weapons of the brain, while using all the weapons, brain makes a mistake unintentionally. Now, brain is going to make a mistake, a blunder, and people are dying. Understand this part now. Very important. Now, the next part is, please understand, what is that mistake happening? Whenever your body will make insulin, insulin is a hormone. Whenever your body will make insulin, right, your body will make one more hormone, equal in quantity. Let's say your body makes 30 unit insulin, your body will make 30 unit the other hormone. The name of that other hormone is, लिख लीजिए, IGF. IGF, insulin-like growth factor. If your body is making 60 unit insulin, your body will make 60 unit IGF. If your body is making 45 unit insulin, your body will make 45 unit IGF. If your body is making 30.6 unit insulin, your body will make 30.6 unit IGF. What is IGF doing? देखो नाम, देखो नाम में सब कुछ लिखा है. IGF, insulin like growth factor. Insulin like growth factor, right? Means whatever amount of insulin will be made, same amount of I will be made. Insulin like growth factor. Growth factor means we were born infants. Now today we are 5 feet, 6 feet. Our height grew, IGF did. Our hairs are growing, IGF did. Our beard mustache is growing, IGF did. Right? Our nails are growing, IGF did. Anything that is related to growth, the entire department is of IGF. How much IGF will be made? Same as insulin. But since in your body, cells were not opening, so brain said to make extra insulin. If extra insulin is made, extra IGF will be made. बात समझ में आई? देखो yes in the chat box if you are understanding. Make extra insulin. If extra insulin is made, extra dash will be made. What is dash? Write on the chat box. If extra insulin is made, extra dash will be made. What is dash? IGF. What does IGF do? IGF does dash. What is that? लिखिए. IGF does dash. देखो, growth. Now, in my body, extra IGF is there. Will it give me extra height? मेरी height बढ़ जाएगी at the age of 34? No. That extra growth in medical terms is called cancer. Is called tumor. Bulb on? Just type bulb on in the chat box if you're connecting the dots. Perfect. Bulb on, bulb on, bulb on, bulb on. So diabetes, BP, heart, cancer, they're not different diseases. I'm audible and visible? I lost my... Perfect. Right? So extra insulin made, extra IGF made, that extra IGF will give you abnormal growth. That abnormal growth in medical terms is called cancer, is called tumor. How many of you are understanding? Just type bulb on in the chat box. Right? So whether it is diabetes, BP, heart, cancer, they're not different diseases. They're not different diseases. They are same diseases, but they have given different protocol, different medicine, different treatment, right? And if my dog is dying of cancer, I'll not go with chemo. I'll not go with surgery. I'll not go with radiation. Humans only do this pop and then they die. So what I'm trying to say you is that these Americans, they are more prone to cancer. Americans, they're more prone to cancer, and we Indians, we are more prone to diabetes, BP, heart, and hormonal imbalance. In India, the next pandemic, women are becoming men. No periods, late periods, facial hair, voice is heavy, muscular body, and men are becoming women. American more prone to cancer, we Indians more prone to diabetes, BP, heart, and hormonal imbalance. Right? When these Americans become fat, the fat will come on their thighs and their hips. And we Indians, when we will get fat, the fat will come on the stomach. अब देखो पतली सी American girl, but the thighs and hips are very heavy. In India, patla sa American Indian boy, Indian girl, but the tummy is little out. How many of you have observed this? Just type OB in the chat box. So 40% of the generation today, they're already half are humans, half females are males, and males are becoming females. Right? Divorces are happening, fertility is down, and this is going to become a pandemic. And it's a taboo. Nobody talks about it. It's a taboo. Nobody talks about. Naturopathy has the solution. Right? So now you must be thinking that, Vishal, you're only talking about 4 diseases: diabetes, BP, heart, and cancer. I'll give you an example which will cover 2000 diseases. Are you okay with that? Just type more in the chat box if you want more. Yeah. Just type more in the chat box if you want more. Great. Awesome. Very nice. So I'll talk about 2000 diseases. 2000 diseases. Before I tell you this 4000 diseases, if you think health is just an ordinary thing, you're just like, okay, just go and sit in a trauma center for 5 minutes. So you'll start loving yourself. If you are lazy, if you're on supplements, if you eat medication, and you think, yes, you're going to survive, you're going to live like a healthy person, just go and sit in trauma center for 5, 10, 15 minutes. You'll start loving yourself. This is what my mentor asked me one day. Now, I'm going to talk about 2000 diseases with one example. Now, understand. Go to the first tool of the brain. Brain bola, drop the extra glucose in the blood vessels. How many of you remember this? Just type R in the chat box. याद है आपको? बादाम खाते हो नहीं खाते? What is the first tool? You remember? Just type R. Oh yeah, great. R, 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 R. Brain said, drop the extra glucose. डाल दिया. I said blood vessels will become hard. हो गई. I said these people high chances will become hypertension patient. Good. But everybody is not hypertension patient. You can say, no, my first disease was thyroid. My first disease was varicose veins or PCOD or this or that. But मुझे तो BP नहीं हुआ. Oh, good, valid question. So what happens when the blood vessels they become hard? One more thing happens in your body, and that's called inflammation. Means when your blood vessels are getting hard, they will also become inflamed. What is inflammation? In simple language, wounds, घाव. शरीर के अंदर छोटे छोटे चोट, घाव. Small wounds inside your body which you cannot see. That inflammation will bring you 2000 diseases. How to learn that 2000 diseases like this? Very simple. See the English name of that disease. So my name is Vishal. Okay, what's the last four word of my Vishal name? Shal, Shal, right? Jyoti. So we have Jyoti over here. Yoti, Yoti, last four alphabets. So see the English name of a disease and just focus on the last four alphabets. If the last four alphabets are ITIS, itis, it's a disease of inflammation. It's a disease of inflammation. Arthritis, otitis, conjunctivitis, pancreatitis, hepatitis, colitis, bronchitis, cellulitis. Thyroid का पूरा नाम thyroiditis. All the mothers and sisters in the room, PCOD, PCOS. कौन है तुम्हारी बड़ी बहन? Vaginitis. Inflammation, 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 inflammation. Right? Internal wounds. If that inflammation happens in your liver, hepatitis. Pancreas, pancreatitis. Colon, colitis. Lungs, bronchitis. Eyes, conjunctivitis. So what is happening? Inflammation. So till today, this is October 2023, right? Till today, there is not a single medicine made of any itis. बचाओ अपने आप को भाई, बचाओ अपने मम्मी पापा भाई बहन बेटा बेटी नाना नानी भाई बहन को. Till today, there is not a single medicine made of any itis. You prove me wrong, again I have to put a lock in my clinic. I'm saying this from last 10 years. Prove me wrong. कोई तो होगा जो मुझे गलत साबित करे. Till today, there is not a single medicine made of any itis. Then a lot of people are thinking right now, then what I'm eating? You're eating medicine for symptoms. Let's say glucose is high. गोली खाया, glucose is normal. कहाँ गया glucose? Medicine takes the glucose from the blood and put it in any organ. Your thyroid was high, T3, T4, TSH was high. Medicine will take the that extra hormone from your blood and put it in the organ. आप खुश नहीं, आपके मुंह में लॉलीपॉप डाल दिया कि बेटा चूसो उसको. Right? Now I'll show you 60 seconds video to make you understand how the medicines are going in your body. Are you okay if I show you 65 seconds video? Just type yes in the chat box. Otherwise, I can move forward. Vitiligo skin disorder, it's a skin disorder. Your body is acidic. तो जो लोग दवा खा रहे हैं, सप्लीमेंट्स खा रहे हैं, आपको you should get a bravery award, right? You should give a bravery award. See this video, you'll understand. So this is how the medicine has been thrown in. Now, a person is diabetic. 300 was glucose. The person eats medicine, the glucose come to 100. Sir, आपने मुंह में लॉलीपॉप डाल दिया, आपको पता ही नहीं. Your glucose was 300. It became 100. You did not urinate it. You did not sweat. You did not cry. Nothing excreted from your body. Where has the glucose gone? It is in your body, but not blood. Or your organs, जहाँ that glucose वो जा रहा है, put it. Kidney, gone kidney. Liver, gone liver. Heart, multiple organ failure. So we are not, it's a failed education system, it's a failed health system. Please accept it. And the only person that you can educate is you yourself by your own knowledge. How many of you are understanding the game? Just type GO in the chat box. Game on. Right? So this is how the medicine goes to your body. Now if you see that organ, वो सड़ रहा होगा, गल रहा होगा, बदबू आ रही होगी, आपकी बॉडी से ज्यादा बदबू उस ऑर्गन में आ रही होगी, because all the extra glucose has been put there, extra hormone has been put there. But आप मेरा ब्लड रिपोर्ट ठीक है, मैडम तुम्हारे मुंह में लॉलीपॉप डाल दिया है, ब्लड रिपोर्ट ठीक है, चूसते रहो उसको जिंदगी भर. So Majority of you are looking for solution. Mind देखता है what is famous. Mind does not see logic. So allopathy is famous. Advertisements, supplements are famous. Shah Rukh Khan, Falana Dimkana. Homeopathy, okay, good. Ayurveda, amazing, right? Unani, Siddha, amazing. Nobody sees ki, yeah, only from without any medicine and supplements we can heal. So mind will not go over there because there's no marketing done. So when you look for solution and you put the root and you put the hammer at the right place. So these are few of my students. I don't call them patients. Varun Rivers is 25 years old, diabetes. 25 साल पुराना diabetes. Right? This is my YouTube channel called GoNature. I'll give you the link. You can see the videos. Harpreet, 11-year-old PCOD. 11-year allopathy medicines, 3 years homeopathy medicines. No periods for 4-5 months. 10 days, all medicines gone. 30 days, periods came back. Kavita, 5-year-old depression. 10 tablets in a day. Harpreet, 12 tablets in a day. Varun, 80 unit insulin. Satish from Indian Air Force, 20-year-old constipation. These guys educated themselves. Deepak reversed his 9-year-old diabetes. Right? Achha, how many cases I have? 6,000. 6,000. Right? Lalita, she started her own clinic. We have a membership in which we teach people how to become nutritionists. Tarun lost 27 kgs in 5 months and his BP medication went in 35 hours, 1.5 days. Video bhi dikha dunga aapko. Vaishali lost 10 kgs in 10 days. Thyroid medicine gone, heart medicine gone. KVS Gupta, Indian Army, lost 13 kgs in 39 days. Total weight loss 40 kgs. Purana video hai. Sciatica pain gone in 8 hours. 8 years old, sciatica pain gone. He's a banker. He just said, I just followed 10% and still I was able to lose 6 kgs. Akshay reversed his type 1 diabetes. He eats 8 kgs mangoes, 2 kgs mango in a day. Right? I'll show the video later. Gopal, 14 kgs in 70 days and his heart problem. 21 diseases in one body. Breast cancer, Dr. Vijaya. 27-year-old sinus issue. He's a nutritionist today. Suresh, he's from Goa. Naturopathy reverse kidney transplant. Doctor said, please find a kidney donor. And he was searching. Somebody told about GoNature. He enrolled. Day 1, diabetes and BP medication gone. Day 45, kidney medicines gone. How many of you want these kinds of results? Just type me in the chat box. Life is very sweet. It should be disease free. It should be diagnosis free. It should be drugs free. And it should be doctors free. Until unless there's an emergency. Great. I can see a lot of me coming. Great. Now, what needs to be done? You need to put effort to live this life. Okay? Simple effort. Now, the top 4 reasons of death worldwide. The first reason of death is cancer. There are 8,000 diseases. Sabse zyada mrityu, the most death happens, that is because of cancer. The second number, heart diseases. Third, I'll tell you later. Fourth is diabetes. 8,000 diseases on this planet Earth. What are the top 4 death reasons? Cancer, heart, diabetes. What is third? I bet you might be the most intelligent person in the room. I bet you will be a IS ranked person in the room. You are a PhD holder. I'll tell you the name, still you'll not know. I'm going to prove it with this broken health and education system. Heterogenic death. Google कीजिए, सबूत ये रहा, British Medical Journal. What is heterogenic death? The word hetero means medicines, and genic comes from genocide, mass killing. Heterogenic death means death due to side effects of eating medicines and supplements. भैया मैं नहीं बोल रहा हूँ, British Medical Journal बोल रहा है. Is it eye-opening? Just type EO in the chat box. Means the medicines you are eating, thinking कि मुझे बचाएगी, that becomes the reason of death. Yeah? EO. तो आंखें खोलने से नहीं एक्शन लेना पड़ता है. आपके घर पे कोई आएगा नहीं, टिंग टोंग, हाय सर, so you're on medication. You have to educate yourself. If you don't understand, if you need more evidences, just go and read this book from Amazon called Death by Prescription. नहीं तो मेरे से PDF ले लेना, उसको read कर लेना. Right? This is the book, you can, Death by Prescription. Prescription means पर्चा, जिस पे दवा लिखते हैं, prescription, right? So now, let's end this last part, blueprint of human anatomy. Right? तो 15 मिनट में खत्म करते हैं. Blueprint of human anatomy. Now, you eat food, you eat medication. People think, let's heal ourselves with medicines. I'm saying heal yourself with food. Now, what happens when food goes in your body and what happens when medicines, drugs goes to your body? Both are very different things, but the rasta is same. So when you eat food, let's say this is your plate. right? 2 chapatis, rice, mixed vegetable dal. You take the first bite. Mouth, you will chew. Stomach, right? Then intestine. Intestine will break the protein. And then liver. So mouth, stomach, intestine, liver. The food is not going to the liver. The enzymes, the nutrition is going to the liver. Now liver, liver is like a second brain. 2.5 kilo का liver है. 2.5 kg is the actual weight of your liver, right? Now before the food has been excreted, there are like 10-12 steps. I'm just teaching you 4 simple: mouth, stomach, intestine, liver. Now what does liver do? Liver is a second brain. It will not let anything go inside your body. So what liver does? It introspects. And liver works on a factor which is called peristaltic reflex. आपको peristaltic reflex क्या है भाई? The way you don't know heterogenic death, इतना tough word. The same way, very tough word, heterogenic, peristaltic. Peristaltic means familiarity factor. Means if liver is familiar with that food that is in your plate, liver will say, okay, please go. Now see what happens when you eat. आपने खाना खाया, अभी lunch किया था ना, क्या हुआ था? What happened when you had lunch or breakfast or anything? खाया, mouth, stomach, intestine, liver. Liver says stop to the food. This is liver says stop. रुक जा भाई, रुक जा, रुक रुक रुक. Breaks लगाओ. Now your liver will ask your blood, your DNA and your RNA. Sir, what to do? क्या करना है इसका? So blood, DNA, RNA has the entire genetic makeup. They will send a signal to the liver. कि liver, this is wheat, millions of years old, natural है. This is rice, this is pulses, this is tomato, this is onion, this is potato, right? जो भी आप खा रहे हो, natural. Liver, this is all natural. आने दो, let them come. Liver says, okay, sir. The food goes inside. Make sense? Just type MSS, what is making sense? Right? एक और तरीके से समझाता हूं. I come to your apartment. I am food. Your chaukidar is liver. Stop, because he does not know me. Your chaukidar will call you. Hi Dipali ji, Vishal Saini खड़े हैं, क्या करना है? अरे मेरा भाई है, भाइयों भेजो. So Dipali is blood DNA RNA. So blood DNA RNA says to chaukidar liver कि yes, I am familiar. Vishal is my brother. आने दो. Understanding? Just type yes if you understood. So this is how, in a very layman language, आप समझ जाएंगे, right? समझ में आया बात? Type yes everybody. Great, awesome. Now let's say this is a tissue paper in my hand. I'm eating this, let's say. Mouth, stomach, intestine, liver. Same रास्ता? और कोई रास्ता नहीं भाई, सेम रास्ता है, सेम पैसेज. Mouth, stomach, intestine, liver. Liver, like food, will stop this tissue paper also. कि भाई रुको, रुक जा, रुक जा, रुक जा. Thumb. Liver will ask blood, DNA, RNA कि क्या करना है boss? Who is this? Who is this tissue paper? Blood, DNA, RNA will send no signal. Why? This is man-made, made from chemicals in a factory. Liver will ask again, no signal will come. Liver will understand, chaukidar will understand that ये कोई चोर है, बहरूपी है. Liver will take this tissue paper, throw in your intestine, and from intestine it will be biotransformed. आपकी potty में अगले दिन दिखेगा. I'm sorry I'm using this word, but to quickly make you understand. So it will be seen in your feces next day, right? Biotransform कर. Knew that. देखो मुझे 1 घंटा हो गया बोलते बोलते. Exam, don't fail in the examination. Tell me honestly in the chat box, the medicines you are eating, your children are eating, or maybe your parents are eating, your siblings are eating, are these medications, supplements millions of years old? Just type yes or no in the chat box. Just type yes or no in the chat box. क्या ये millions of years old हैं? लिखो भाई, सारे जल्दी करो. Everybody typing no. फटाफट लिखो. एक गीता लिखनी है yes, बाकी सबने no लिखा है. नहीं, गीता it's not millions of years old. Modern medicine, they say 100 years, but it's not even 100 years. It's like 70-80 years old. आप 100 ले लो. So these medicines are not millions of years old. Will the liver recognize? A big no. But you're getting relief. आपका periods आ गया, thyroid ठीक हो गया, BP normal, sugar normal. Why? Because there is a trick. For example, if I'm diabetic, right? I eat a medicine, my glucose is not normal. I'll ask for refund. So ये मैं बोलूंगा आपके साथ एक धोखा हुआ है. आपको च पे उ की मात्रा, त पे ई की मात्रा, य पे आ की मात्रा काट दिया है. व्हाट इज दैट? लेट मी टीच यू. आई एम सॉरी आई एम यूजिंग दिस वर्ड, बट दिस इज ओनली वे आई कैन टीच यू. आप लिटरली आपको काट दिए. दे वर्क, the medicines work on a factor, the हर चीज evidence based है. They work on a factor called half life dose or half life drugs. 30 seconds दे रहा हूं, Google this word. What is half life dose, half life drugs? 20 seconds left. Half life dose, half life drugs means whatever is the requirement of the patient. Prescribe the double dose. Whatever liver can stop, uska double खुराक दो. Are you understanding? Just type yes in the chat box. Go to medical books, open toxicology. In toxicology, you will find this word called half-life dose, half-life drugs. Whatever जितना भी पेशेंट को चाहिए उसका डबल दे दो. बट हाउ टू डिसाइड दैट कि तुम्हें कितना चाहिए, मुझे कितना चाहिए? हाउ टू डिसाइड दैट? इट्स अजम्पशन का गेम. Let me explain you. Let's say my glucose was high. I take my appointment. मैंने अपॉइंटमेंट लिया. Okay, now it's written विशाल सैनी, एज 34, 300 ग्लूकोज. अरे बाप रे, यंग लड़का है, 300 ग्लूकोज, 500 mg मेटफॉर्मिन दे देता हूं. The person was about to write 500 mg, but no, 500 liver will throw in the potty. Then I will write इसका double 1000. Vishal will go to chemist, buy 1000 mg गोली, eat 1000 की, mouth, stomach, intestine, liver. Liver, आपका चौकीदार could only manage 500 chore, but 1000 came. So liver could only manage 500 mg, but 1000 mg came. 500 mg liver throw, 500 mg liver could not stop, which came in your blood. It is called the first pass होता है, थर्ड पास वो बाद में बताऊंगा कभी. Then it goes to your blood. वो आपके पीरियड्स आ गए, आपका थायराइड ठीक हो गया, आपका ग्लूकोज नॉर्मल, आपका बीपी नॉर्मल, धड़कनें बज गई, राइट? बट आपको बना दिया है डैश. So this is going year after year, you're eating on medication, right? So you eat medicines for 1 month, 6 months, 9 months, 1 year, 2 year. After you eat medication for a long time, your liver, the second brain, वो कहेगा बॉस समथिंग इज रॉन्ग, कुछ गड़बड़ है. सो नाउ सी, लीवर इज अ सेकंड ब्रेन, वो सोच समझ सकता है, राइट? उसको लीवर को काट दो, वो छिपकली की तरह पूंछ की तरह उगाएगा. नाउ व्हाट हैपेंस? लीवर, टू प्रोटेक्ट मी, टू प्रोटेक्ट यू, विल अपग्रेड इटसेल्फ, will upgrade itself. Means earlier it was like you have a motorcycle, 300cc, 600cc. Now earlier it was 300cc, now the lever is 600cc. Sorry, earlier the lever was 500cc, now it is 1000cc. Now what is happening now? I eat one same tablet, same disease. I'm eating the medicine, but lever is powerful. Earlier 500 was going in my potty, but now 1000 is going. My symptoms will come back. I will take my next appointment. अब मैं शाहरुख खान नहीं हूँ, बोलेगा भाई पर्चा दिखाओ. मैं शाहरुख खान है क्या? नहीं. विराट नहीं, विशाल सैनी, सिंपल लड़का. पर्चा दिखाओ. आई शो द पर्चा. विशाल सैनी 2022, 1000 mg, कट 1000 mg, मेक इट 2000. आई गो टू केमिस्ट, 2000. मुझे क्या मतलब, क्या लिखा है पर्चे पे? आपको कभी पढ़ा है आपने? व्हाट इज द सॉल्ट, व्हाट इज द मेडिसिन? नहीं. 2000 mg. यू ईट 2000, 1000 इन पॉटी, 1000 इन सर्कुलेशन. इज इट मेकिंग सेंस टू यू, पढ़े लिखे लोगों? Just type yes in the chat box if it is making sense. सारे लिखो yes if it is making sense to you. Right? Now. Good. Thank you. Have your medicine ever changed? Just type yes again. Just type YE triple S if your medicine has ever changed. Your medicine, your children, your parents' medicine. कभी तो बदला होगा ना? It's not change. It's high dosage. Right? It's high dosage. समझो बात को. तो how are people dying then? See, when you keep eating medicine, I use the liver will upgrade. 1000 mg, 2000, 4000, एंड नहीं है. वो मार्केट है. तुम खाते रहो, मर जाओ, कोई फर्क नहीं पड़ेगा किसी को. कौन हो तुम? नरेंद्र मोदी हो? नथिंग. लाखों लोग मरते रोज, तुम भी मर गए, क्या फर्क पड़ेगा? This is the logic. Understand? You keep eating medicines, 1000, 2000, 4000 combination drug, and your liver is upgrading. Alcoholic person, one peg, two peg, kuch nahi hua. After 10 years, sorry, one peg, alcoholic person, one peg. After 10 years, he'll drink the entire bottle. What is that one organ that an alcoholic person loses? Chat में लिखो. शराबी का क्या जाता है? Please tell me in the chat box. Liver. दारू मत पे लीवर सड़ जाएगा रे भाई. Everybody is eating liver, 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 liver. But when you eat medicines, it is not said this. It is called multiple organ failure. And you will fail to connect the dots. कि साला वो जो पैरासीटामोल में खाया था उससे मुझे फर्स्ट डिजीज, सेकंड डिजीज, थर्ड डिजीज एंड देन सीरीज ऑफ डिजीजेस. You'll fail to understand that because we are not taught that way. हमको क्या सिखाया है बचपन से? सरदर्द सिर्फ एक सैराडॉल. कुछ लेते क्यों नहीं शर्मा जी? And you're in that trap. So you are destroying yourself. See, your problem, when you had a problem day one, it was bad condition. Then medicines came, right? Then medicines came. It is worse now. How many of you agree with me? Just type AG in the chat box. And problem वैसी की वैसी है. You are still a patient of that particular disease. Right? Good. अभी क्या करना है? You need to understand that your liver, kidney is your assets. तुम्हारी मर्सिडीज तुम्हारी कार नहीं assets. भूल जाओ. तुम्हारा घर, relationship, husband, wife, बच्चे, all temporary. When I was on bed for 6 months, I knew. Now, all you have to understand is that you have to protect your liver, you have to protect your kidney, and you have to come out of medication. And why I'm so confident you can come out of medication? Because I knew majority of you were not born with these diseases. Am I correct? Just type yes in the chat box if I'm correct. The disease you have right now, you were not born with that. Right? So भगवान ने भरोसा करो, there is some method. It's not a coincidence that you saw my ad and you're in this webinar. Right? So there is no end of medicines. For example, two policemen, अब ये confuse, ये पुलिस की फोटो क्यों लगाई? ये समझा देता हूँ एक मिनट में. Now two policemen checking cars. Let's say this is Noida Pari Chowk. I'm a drug dealer. I'm checking यार drugs पकड़े जाएंगे. So I'll put my 200 cars back to back. Thak, 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 traffic jam. Now these two policemen will let go 5 car, 1 car check कर लेंगे. They'll let go 4-5 car, they'll check 1 car. This is how medication goes to your body. Now these two policemen are fed up. Their liver परेशान हो गए. Please call 2 more. Now 2 policemen become 4. Each and every car is being checked again. चोर पकड़ा गया. I'll put my 400 cars. 8 policemen will come. I'll put my 800 cars. 16 policemen will come. I'll put my 1600 cars. ये आपका disease medicine चलता रहेगा भाई. 20 साल, 30 साल, 40, 50, 60, स्वाहा. And you did not even knew people जो मर गए बेचारों को ये नहीं पता कि ये दवाइयों ने मारा. Making sense? Just type MSS making super sense to you. So there is no end of medicines. भूल जाओ. डब्बे खाओ, supplements खाओ. मेरा डॉगी तो नहीं खाता, आप भी मत खाओ. Yes, I'm putting salts on your wounds because I want you to feel that you are important. You are expensive. I'm not criticizing any medical doctor for your kind information. I train medical doctors. अभी जो मेरा current training चल रहा है उसमें 5 medical doctors हैं. I'm training 40 people to become a nutritionist. There are 4 medical doctors in that. And in past, it's like total if you see, there are like 50, 60 medical doctors I have trained. I'm very grateful to medical doctors. I am alive because of medical doctors. I had an accident. I was about to die. My mother had a cyst in her brain, went to AIMS, surgery done, boom. This is what I'm qualified for. I'm a registered naturopath. Like, for example, I need to be someone to teach all these things. So I'm a registered naturopath. My certificates are attested from the Ministry of Ministry of External Affairs, and I can practice anywhere in the world. Nutritionist. ये सुन के बड़ा अच्छा लग रहा है. Good, thank you. Yes, I am this. But let me tell you, whatever I learned from these schools, colleges, degrees, I'm not teaching that. Good, fine, with due respect. but these syllabus were made in 1960s 50s, वो अभी तक चल रहा है. My teaching come from my diseases, my mentors, what they have taught me, and medical journals, whistleblower naturopaths. So I got a chance to give my knowledge to Indian Army, Indian Navy, Indian Air Force. I took permission to pose this photograph, and it's like showing candle to the sun. So what I learned from this Indian Army is that if you have a problem, the first person you should seek help is you yourself. अगर आप अपनी उठा के हेल्प किसी और को दे दोगे, भाई वो तुमसे ज्यादा बीमार है आज की डेट में, and you're looking for help from them. Are you understanding? Just type yes in the chat box. The only person who can help you to come out of your diseases is your knowledge, says अमिताभ बच्चन ने कौन बनेगा करोड़पति. तुम्हारा ज्ञान ही तुम्हें बचाएगा. राइट नाउ सोल्यूशन क्या है? देखो, इट्स नॉट मैगी कि भाई ये खा लेती, नहीं. It's a one word treatment. I started with this, I'll end with this. The one word treatment. Right? Is my screen visible to everyone? Just type yes. Pooja Verma says not visible. Is my screen visible to everyone? मैंने हटाया नहीं PPT, मैडम वही चल रहा तब से. Okay, it's visible. Thank you. So the one word treatment that each one of you should focus. I know people who have stopped sending their children to schools. Homeschooling concept is there. स्कूल में कमजोर बना देते हैं कि तुम ये नहीं कर सकते, तुम ये नहीं कर सकते, तुम ये नहीं कर सकते, तुम्हारे जीरो आएंगे. राइट? आई नो पीपल हु हैव स्टॉप्ड टेकिंग मेडिकेशन. देयर इज अ वे टू डू दैट. इट्स नॉट यू बिकम इंपल्सिव, मैं नहीं खाना दवाइयां. नो. सो द वन वर्ड ट्रीटमेंट इज एनर्जी. यू नीड टू वर्क ऑन योर एनर्जी. इज इट मेकिंग सेंस? I know it was a free webinar. आपका दिमाग खर्च हुआ कि नहीं हुआ? Just type yes in the chat box. It was a free webinar, but something you spend today is your brain. And what I'm teaching you today, you will forget in the next 24 hours. All I'm requesting is that if you are ready to live a permanent natural life, and I took this initiative globally, right? In Doordarshan, I was a television anchor. I was certified 23 times by the President of India for covering shows on sports and health. Then last year I got 40 under 40 by Business World Health Coaches in India in 2022. In 2023, I got 40 under 40 Indians globally. My simple question to you, हाँ या ना? सीखना चाहते हो, हाँ या ना? How to live a disease-free life. Simple, no fluff. Good. अपन क्या करेंगे? बहुत ध्यान से देखना. ये शो ऑफ नहीं कर रहा हूं, बट आई एम टेलिंग यू दीज पीपल लाइक मलाइका अरोड़ा. आई वर्कड विद हर फॉर 2 months. जैकी श्रॉफ 2 years. Rajashri Daman, he is right hand of Honorable Prime Minister Narendra Modi. Right? So what I learned from these celebrities are that there are like 20 more celebrities in my community. I'm not show offing, like Punjabi हूँ, show off मेरे blood में है, but I'm not doing that right now. What I'm saying is that these people are very intelligent. These people are very intelligent. Be like them. Now, what you see health is this. Blood work होगा, diagnosis होगा, and what I'm saying, you have to see like this. Logically come in the safe zone. How many of you want to come in the safe zone? Just type SZ in the chat box. SZ. And it's not, the training I'm going to give you is not just for you, it's for your entire family members. Right? It's going to be a live training. आपको लग रहा है कि मैं आपको कोई कोर्स बेचूंगा? मेरे पास कोई कोर्स नहीं है, मेरे पास लाइव ट्रेनिंग है. Right? I have live training. So this is how the training goes. You see people like this. ये रहा मैं, ये रहा, you know, here I am. So we're going to learn it live. Okay? So I've done more than 300 sessions in the last 3 years. I think it's reached 400 something. मेरा आवाज खराब हो गया था. Then I started learning this gut speaking. So right now I'm speaking from my stomach. So that's why I'm able to speak better. So we do a lot of live trainings. And I have more than 6,000 testimonials. More than 6,000. Right? More than 6,000 testimonials. Now, let's do a quick recap. कि आज अपन ने क्या सीखा है. पेन निकाल लो फटाफट. We learned 6 principles of naturopathy. Then current health situation of India, I told you. Right? 49% diabetic, heart disease, blah, 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 blah. Medical industry versus medical science. I said I'll be talking about medical science, not medical industry. Then I said two kinds of people, you are in one category, right? And majority of you will be in medicine and supplements category. Even if you're not, again, you learned a lot today. Journey of efforts, wellness, freedom, and suffering. So wellness freedom started from a diagnosis, फिर वो सिलसिला स्टार्ट हो गया दवाइयों का. Then I talked about awareness and insights. कि भाई, you have to become an inside broker. Then I said modern slavery, brain wala I told you. Okay. Then I said target 100 model of the brain. I said your brain works on a principle that's called 100 target 100 model. Your brain has tools. Then I said you all are diabetic. And what is diabetes? I said energy is glucose and you need to work on that. Then I said what is 300 reading? It means in 1 liter 3 gram glucose. Then I said your blood vessels is Earth's 2.5 round. Then I said your blood vessel is highway and your blood is truck. Then I said the tools of the brain. Right? Then I said tools of the brain. First, drop the extra glucose. अरे hard हो गया, BP बन गए. Then brain said, okay, transport that. Right? Then cells are not opening. Then make insulin. Right? IGF was made. Then what we said, IGF जब disbalance होगा, these are the people who will become cancer patients, and the chances of genetic is just 2%. Means if my father had cancer, my grandfather had cancer, I have 2% chance. But today you have made it 20, 30, 40, 50% chance. Then I said diabetes, BP, heart cancer, it's all same. And I give you the example of itis family. And when it comes to heart, हाँ ये नहीं बताया था मैंने. When it comes to inflammation in the heart, it's not itis, it's IDIS, itis, right? And then I said the example of American and Indian. American thighs and hips heavy, India का पेट बाहर निकलेगा. Then I said men becoming women, women becoming men. Then search of solution. Allopathy, homeopathy, सब महान है भैया, कोई बुरा नहीं होता. But what time, what you need is the key. Then I said case studies दिखाया मैंने आपको. ऐसे मेरे पास 6000 हैं. I'll play some videos if you want later. I'll give you my YouTube channel link. Top 4 reasons of death worldwide. Heterogenic death, I told one of the reason. Then liver is a second brain. Liver works on familiarity factor. Then blood, DNA, RNA signals भेजते हैं. Then only liver says, हाँ जी आइए सर अंदर आप आइए. Then I told medicine work on a factor which is called half-life dose, right? Then alcohol and medicine is all same, right? But alcohol coming from दारू का ठेका, तुम उसको गालियां दोगे. Medicines coming from white collar people, आप उनके आगे हाथ जोड़ोगे. Fine, हाथ जोड़ो. But if you're eating medicine for lifetime, so those medicines will actually kill you. मैं नहीं बोल रहा हूँ, there's all evidences over there, right? Then liver upgrades, दवा चल रही है, upgrade, and a point will come that your liver is not responding. तो हाथ खड़े कर देंगे. अब आप एम्स चले जाओ, टाटा मेमोरियल चले जाओ, भैया हमें बख्श दो. Liver is not responding because you've eaten so much medicines. Liver जितना maximum it could have upgraded हो गया, अब नहीं, no more, right? Death by prescription, there's a book that you can read, and medicines have been biotransformed. I talked about heterogenic death, British Medical Journal. पुलिस एग्जांपल दिया मैंने आपको. नो एंड ऑफ मेडिसिन सप्लीमेंट्स, ये समझ गए तो बच जाओगे. देन लर्न फ्रॉम इंडियन आर्म फोर्सेस, वन वर्ड ट्रीटमेंट एनर्जी, एंड आई गॉट दिस अवार्ड. टोटल 35 थिंग्स यू लर्न. से मी थैंक यू. फटाफट लिखो थैंक यू, नहीं तो यूनिवर्स बुरा मान जाएगा. भाई ये सब फ्री में था. थैंक यू. You're welcome. You're welcome. Right? चलो अभी क्या करेंगे, इसका स्क्रीनशॉट ले लो. बिकॉज व्हेन यू सी दिस ना, वो माइंड में एक रिमाइंडर आता रहेगा. यू कैन टेक अ स्क्रीनशॉट और चिपका दो उसको मेरे बेडरूम में. अरे हाँ, एक पागल से मिले तो उसने ये को समझाया मेरे को. चलो, सैनी जी को डाइट चाहिए. सैनी जी अभी डाइट नहीं दे पाएंगे हम आपको. यू आर डिफरेंट, राइट? चलो आगे चलते हैं. अभी व्हाट इज द नेक्स्ट एक्शन स्टेप? अभी देखो, नॉलेज इज पावर. व्हाट यू हैव लर्न टुडे, यू हैव टू कीप इट इन योर माइंड फॉर एवर. Learn more life-saving things or spend your entire life savings on known and unknown diseases. The next thing you should understand is that what we learned today, 99% you will forget in the next 48 hours, right? Because what we have done today, it was a trailer. आप बोलोगे यार 2 घंटे का ट्रेलर. Yes, it was a trailer. So do you want to see a movie? Wrong. You don't need a movie. You do not need trailer. You do not movie. So what you need? Life is a dash. You need learning like a dash. इसको फिल करो. सो लाइफ इज अ सीरीज. यू नीड टू लर्न लाइक अ सीरीज. ओके, तो हम लोग क्या करेंगे? आई एम गोइंग टू टीच यू लाइव. How many of you are interested? Just type me in the chat box if you are really interested. Perfect. Me. Perfect. Great. So now what we are going to learn will actually blow your mind, guys. Okay? Live training करेंगे. तीन चीजें are the most important thing that you should understand to come out of your diseases. First one is a live training on structured diet. Okay? Now, the right food, if it goes to your body, it will start healing. The second course is I'll teach you how to hold your breath for 5 minutes. This is the most important thing. Tortoise live for 300 years. Why? Tortoise take one breath in a minute. Dog live for 13 years, 14 years. Why? Dog take 120, 130 breath in a minute. Do your research work. All the animals see their breath work timing and you will see correlate with their health. Humans were meant to live 300 years. फिर वो 200 हुआ. सुश्रुत, निघंटु, वाघभट जी जब तक आए. Now it came to very down. It's like 40, 50, 60 years, 70 years. But we are designed to live more than 100 years just by controlling our breath. आपको यकीन नहीं होगा, but yes, you will be able to hold your breath for 5 minutes or maybe more. The third course, the most important one, is the live training, healing with water. How water can heal you. Now see what is common in these three things. कौर से देखो, like a detective. कि इनको why I'm giving this priority to food, breathing and water. सोचो. Because I want you to understand all the one common thing between all these three is oxygen. The food gives you oxygen and enzymes, the way you breathe and the water you drink. ये हमारा मेन कोर्स है, राइट? उसके बाद एक और मेन कोर्स है, आई कॉल्ड is a support, right? So I'm going to give you a 1-year subscription in which we'll do these classes, online teaching, online learning, everything, right? Now there is one more main course. I called it a 2-day live workshop on Zoom. ये 2 दिन आप मुझे देंगे. इसमें मैं आपको क्या सिखाऊंगा? That will change the way you look at health and that will change the way your body reacts. Day 1, protection from EMF. I told you this. Mobile tower, phone, सब कुछ आपके घर में है. After this training, you will be able to protect you and your family members from harmful electromagnetic fields, 5G tower, 6G tower, mobile radiation, internet, Wi-Fi. ये सब मैं आपको evidence के साथ ठीक करेगा. Training 2, food detective program. After this training, you will come to know that majority of food that you were eating wrong, you have to eliminate it. Training 3, course number 3 दिख रहा है, healing with water. We will do it live. How to heal with water. I'm not selling any Kangen water or stuff like that. कुछ नहीं बेचूंगा मैं. I'll just teach you exactly how to make the right water. Why Green Tribunal has given the petition to the Supreme Court कि जज साहब, please stop advertising RO water. By the way, my dog does not drink RO water. मर जाएगा. आपके घर में सब पी रहे होंगे. Kangen water में बेच नहीं रहा. तो कराऊंगा क्या? Things which are hidden. I will reveal those things. The horsepower formula. स्टेमिना इज लो, इनफर्टिलिटी, सेक्सुअल स्टेमिना नहीं है, थक जाते हैं, राइट? सो you'll become a kind of horse in this after this training. The structured diet, course number 1. What is the right? There are 13 structures of the food. 13 structures. You should know each and every structure and what they do. Then pesticides protection protocol. GMO food is in the market. Man-made tomatoes, man-made cucumber, man-made sweet corn, man-made wheat, man-made rice. राइट? इंसान के बनाए हुए बीज, जेनेटिकली मॉडिफाइड. हाउ टू सिलेक्ट द राइट फूड फॉर योर एंटायर फैमिली. ऐसे डाइट्स इन पैंडेमिक. व्हाट इफ पैंडेमिक्स हिट्स अगेन? व्हाट शुड बी इन योर होम, राइट? यूजिंग बॉडीज हीट एज मेडिसिन. खरगोश, छिपकली, they use their body heats to heal themselves. How you can use that, you will learn after this training. Day 2, removing the root cause of diseases. What is that one root cause of diseases that each one of you can apply from your home without any supplements. Activating body signaling system. So brain के tools है ना, I'm going to share each and every tool, not each and every, there are thousands of tools. I'm going to share some tools in which your body's activating system becomes very fast. Like example, मुझे प्यास लगी, मेरी आंखों ने बॉटल को देखा, मेरी आंखों ने मेरे हैंड को बोला लिफ्ट दैट बॉटल. Now my hands lift that bottle. Now I hold this. Now I'm opening. Now I will lift this bottle and I'm drinking. I'm taking my saliva in. Because in my neurons of my brain, somewhere it is written that saliva should go inside your water, inside with the water. So activating body signaling system, right? Now, so Virat Kohli is batting. Chakka maru, chokka maru. Within split second, you have to make that decision. So activating body signaling system. ये आप सीखोगे इस वाले कोर्स के बाद, ट्रेनिंग के बाद. A god called cholesterol. अभी क्या है? Cholesterol is a god. You know, one egg is what? 70-80% cholesterol. Your brain is 90% cholesterol. And we are eating cholesterol-free biscuits, cholesterol-free atta. It's a very important training that I'm going to give you. Then how not to die from cancer. I'll prove you with government evidence that PET scan and biopsy cannot reveal are these cancer cells or not. These are cells, but are they aggressive cancer cells or dormant, shant baithe cancer cells? This cannot be differentiated with scientific evidences. And every 15 Indian will be dying of cancer. So ये एक बहुत सी ट्रेनिंग आपको मिलेगी. Disease monitoring awareness. Disease monitoring means, अच्छा, diabetes everybody knew. 8 years before a concept came, pre-diabetic, pre-hypertension means either you are ill or you are about to get ill. Healthy कोई नहीं है भैया. या तो दवा खाओ, right? या तो दवा खानी है या दवाई स्टार्ट करो. So I am going to teach you exactly how 8,000 diseases are going. In 1600 CC, 1600 BC or whatever, 1600 सदी में, there were 65 diseases. अभी कितनी है? 8,000. So you will be learning, and maybe many of your diseases will not come in the disease category. The drug mechanism, how, today we learned mouth, stomach, and how the medicines are working. We'll go a little advanced कि कैसे हटा सकते हैं medicines. Then being your own guru in the 21st century. This is the most important thing. So this is the entire thing, and I will give you 12 months of subscription. 12 महीने you can attend my morning session, evening session. If you miss the 2-day live training, you can come with the next batch. 12 महीने का मैं access दूंगा. Is that okay? Just type okay in the chat box. Perfect. Right? What is the cost? कुछ नहीं है cost, right? You are expensive. Right? You are expensive. So now with this, once this 2-day training ends, I'll also give you a 28 days challenge. When you complete this 28 days challenge, I'll give you this beautifully made certified health advisor certificate with code of ethics. Means what is the power of this certificate? Right? What is the power of the certificate? So I'll give you the code of ethics also. Now, how many of you want to join? Just type me in the chat box. Live करेंगे. Type me. Me. Great. Now, if I tell you the original price of this 12-month subscription, right? I'm a corporate guy. I do this training in corporates for 29,999, 30,000 rupees. 100 people in the room, 40 people buy, 50 people buy, good. But when I do training like this, I give 50% off. I give 50% off, right? But when I do my live webinars, for first 40 students, I usually keep this at a very low price so that everybody can afford it. The price is 5,999 rupees for 1 year subscription. Means 500 rupees monthly. How many of you want more? Just type more in the chat box. How many want something more, something special? Because I want each one of you not to just protect yourself, but your family members from the supplements, medicines, right water drinking, electromagnetic fields, mobile tower, दुनिया online हो रही है, but उसकी radiations हमें मार रही है. So I want each one of you to grab this only for first 40 students. The price of this training is not 29,999 or 14,999 or 5,999, and it's not 12 months, it is 13 months, and the price is 2,600 rupees for a 13-month subscription for the first 40 students. How many of you are in? Just type me in the chat box. Me. You will get the results in the first 2-3 months, but we will do training for 13 months. Cool. So here is the link in the chat box, right? Here's the link in the chat box. Go, click, make the decision straight away. If you make this 2,600 rupees right now, after 15 minutes, or if 40 students have already taken, this link will automatically show 5,999 rupees. So here is the payment link in the chat box. Here is the payment link in the chat box for the first 15 students, or for the first 40 students. This entire subscription with my community is 13 months. Means November 2024 तक आपको इसका एक्सेस मिलेगा. पूजा वर्मा आस्किंग जीपे. पूजा, व्हेन यू विल क्लिक ऑन दिस लिंक, इसी में आपको जीपे भी मिल जाएगा. आप जाइए, चेक कीजिए. राइट, जस्ट गो एंड क्लिक ऑन दिस लिंक, and your time has already started. After 13 minutes, I'll make it 5,999 rupees. What extra you will learn? Now, 14th October, 7 a.m. power breathing session. You will learn to hold your breath for 5 minutes. Guaranteed. नहीं तो पैसा ले लेना वापस. On 14th October, 7 a.m., we have the first power breathing session. Right? And what I'm saying, guaranteed. 5 minutes, you will be able to hold your breath. Your lungs will become elastic. Not that particular date, but it will take 2 to 3 months to come to 5 minutes. If you do it sincerely, maybe 1 month. So more air will go to your body, right? More oxygen will go to your body. Hence, your body will become alkaline. अगर ये आपने बात कर लिया तो कमाल हो जाएगा, right? So Rahul Shastri, payment received. Vinod Khijoria, payment received. Shanti Swami, payment received. Nandini, payment received. Ajit, payment received. Parul Goswami, payment received. Vichitra Deol, payment received. Good. So here's the payment link in the chat box. 10 minutes and the offer will go to 5,999 rupees. This is life changing. Then same 14th October evening may we will meet 6:15 to 8 p.m. I will take questions related to your health. बहुत मजा आएगा यहाँ पे, because people ask very great questions. You will learn from those questions and answers, right? So here's the payment link in the chat box. Once you make the payment, an email will come to you and you will have to join a WhatsApp group and a Telegram group. Tomorrow, my team will also connect with you, those who are making the payment, to make sure that you have received all the things, right? So here is the payment link in the chat box. मैं फिर बता रहा हूं, what you will learn. This is something what you will be learning, right? EMF, ये देख रहे हो? When you go like this, electromagnetic fields. Why? Because there is a phone near me, there is a Wi-Fi, there is internet, there's satellite, and so we have to make sure that our family should know all these practices to live a disease-free life. Food detective program, healing with water. RO water is a poison. Here's a payment link in the chat box. 200 रुपए महीना for the next 13 months. 200 रुपए में आप बर्गर, पैटी, कोल्ड ड्रिंक, न जाने क्या सत्यानाश करते हो. And I am saying कि इसको ले लो. Day 1 मेरा complete होगा. The day I will complete this day 1, you will get so much insights. आप बोलोगे कि विशाल, this course would have been 26 lakh rupees the way you are teaching us, right? So this is Yes, I'm receiving a lot of payments. 29 payments received till now. I'm going to take the names later. I can see 29 payments received. Right? The horsepower formula. How to have a stamina that you can do start mountains, trekking, and आपकी सांस नहीं फूलेगी. You will stop using lift, and your house in the 15th floor, you will not feel tired. Pesticides protection protocol. ये जो theater में you're eating sweet corn, it is man-made. The cucumber and tomatoes, it is man-made. Wheat and rice, after green revolution, it is man-made. How to select that food for your family members, right? If morning and evening session you miss, you will be getting the recordings. 2-day workshop का recording नहीं मिलेगा. If you miss, you can join with the next batch. But morning session, evening session recordings you will get. We also have an affiliate program. If you make people join through this, you will be getting 10% as commissions. Means if you join, 13 people will join, your money will come back to you. Right? Yes, here's the payment link in the chat box. 5 minutes left. And when you will click on this link, it will show you 5,999. I will not make any discount after that. Rajani Parmar, please send me your Paytm number. I will send you to from another number. Ria, you can send Paytm number to her, but make Rajani, you have to send us your email address and phone number also. Right? So in this Paytm system is also there. If you click on this link, click on this link. अभी मैं आपको और दिखाऊंगा कि और आपको कोर्स में what I'm giving you extra. When you click on this link, it will show like this: Naturopathy Healing System. Okay, 2,600 rupees. Naturopathy Healing System 2,600. Put your name over here. Put your phone over here. Put your email over here. When you click on pay now, see, debit card. This is card. You see this card? You can go to card if you want to pay through card. If you want to pay through UPI, QR code, Paytm, Google Pay, Phone Pay, Bheem app, just click on this. Anybody wants to do net banking, wallet, EMI system, everything is over here, right? 200 rupees per month and you get the best knowledge, right? Now let me show you some case studies. Here's the payment link in the chat box. 2,600 rupees, guys. एक टी-शर्ट पजामा नहीं आता, पैंट नहीं आती, 2600 रुपए की. I am giving you my 16 years of hard work in a platter because I genuinely want that naturopathy should spread. I genuinely want you and your entire family should come out of your diseases. I genuinely want that so should be आपको लगे कि यार yes, naturopathy is the real magic. 2,600 rupees, nothing is there. कुछ नहीं आता. I think 3 minutes left. Sorry, 2 minutes left. मेरे पास टाइमर लगा हुआ है and this link will become 5,999 rupees, guys. I'm sorry. I only work with people who are action takers. I'm a little crazy about these things. So, ये सब कुछ आपको मिलेगा. Diets in pandemic, how to use body's heat as medicine. अभी आपको Google, I'll give you my YouTube channel link. See Dr. What was Nishi. In 30 minutes, her fever came down. 30 minutes. I'll show this video. Just wait with me. Removing the root cause of diseases, activating body signaling system, right? A god called cholesterol, how not to die from cancer, disease monitoring awareness, the drug mechanism, advance, and being your own guru in 21st century, right? Now see this. Our training starts 14th October, Saturday, 7 a.m. Bring your friend, bring your mummy, papa, brother, husband, wife, children. No problem. Empty stomach, water bottle, and a stopwatch. That's it. Okay? Same day, evening, we have our weekly mastermind. I'll take questions over here. जो 2 दिन की ट्रेनिंग है, right? That is the most important. High workshop, holistic integration for the gut healing, right? Which 2-day training? Everybody see this? This 2-day, day 1, day 2. You see this? Day 1, day 2. ये कब है हमारा? Here is the date. 21st and 22nd October. 9 a.m. the session will start and 6 p.m. it will end. Write it down. 9 a.m. to 11 a.m. Session 1. 11 to 11:30 break. 11:30 to 1:30, session 2. 1:30 to 2:30, lunch break. 2:30 to 4:30, third session. 4:30 to 5, break. And 5 to 6, fourth and final session. Day 1 and day 2. बस ये 2 दिन 18 घंटे आप मुझे दे दीजिए and you are sorted. Right? So, एक किताब मैं आपको बताऊंगा वर्कशॉप में which says the truth has been hidden from us while a global policy of mass depopulation, heterogenic death, mass depopulation and exploitation has been carried. This is on, I'm not a whistleblower, this is already in media, has been carried out behind the scenes from past half century. The author and independent journalist became aware of this agenda only a few years back, right? इसमें देखो क्या है, the testimony of whistleblowers worldwide have exposed these strategies. They include geoengineering, नकली बारिश कर देना, बाढ़ ले आना, chemtrails बोलते हैं उसको, fluoridation of water supplies, RO water, GMO, नकली खाना, genetically modified crops, vaccination. इसके side effects हैं, I'll tell you the methods to come out of the side effects, if any. False flag terrorist attack. So this is all public now. Jago. So all these information would be coming. Then these are the government agencies: JAMA, Journal of American Medical Association, New England Journal of Medicines, Journal of Medical Affairs, WHO and Cochrane. They say if 100 people goes to modern medical doctors, only 11 people will benefit, rest 89 people will suffer more. Right? Then detoxification, how we will start? See this. Men with ED are 2.6 times more likely to have mobile phones in their front pocket of their pants. Unearth हो रहा है. Why children are so weak today? चश्मा लगा हुआ है. You remember your school days, if you know 30s and 40s, 6 फीट के लड़के क्रिकेट खेल रहे हैं, फुटबॉल खेल रहे हैं, पागल कुछ भी नहीं होता था हमको. Now if you ask, go have a 2 rounds, आपको लगा भैया कुछ होना जाए बच्चों को. This is the reason. See, cell phone radiations causes sperm count, sperm motility. आपको नहीं लगता entire world is getting online? You should know how to protect yourself from these radiations. I think the price has gone up to 5,999. Let me check. Yeah, here's the payment link. 2,600 rupees, 13 months you will be with me. 13 months you will be with me. 200 rupees monthly, and I will make you a brand new person. Right? Please take this silver membership and you are sorted, my friend. Wi-Fi can reduce male fertility. Use of laptop computers connected to internet through Wi-Fi decreases human sperm motility and increases sperm DNA. So laptop was not meant for labs. Phone का असली नाम क्या है? Palm tops. Palm top was not meant for your hand. आपका एक Canon का प्रिंटर आपके घर के में है, अगर आपके ऑफिस में है, it can give you those radiations. So what should be the distance? How to protect your family members when they are sleeping? So here is the payment link. I have just extended the offer for 5 more minutes. After this, it will go to 5,900 rupees. Right? Now, if you see these mobile towers, here is the evidence in the bottom. In 500 meters, इस टावर के अगर आपके घर है, in 500 meters, more cancer, more depression, more anxiety, more insomnia, more diseases. Can you remove this tower? No. I'll give you the solutions. Right? What is next? EMF exposure can increase miscarriages. Just imagine a pregnant woman bore ho rahi hai, watching Netflix. What you are doing in the womb? No, the classes are not every day, Shruti. The classes is on 7th, 14th, ko hai class, morning, evening. Then next class 21, 22nd. After 21 and 22 second, the classes will be every Saturday 7 a.m. and 6 p.m. 7 a.m. 6 p.m. on Saturdays. Now just imagine 30 years back, nobody know what is an IVF hospital. In the last 20-30 years, see the exposure of internet, Wi-Fi, internet का आना and miscarriages का धम से होना is all interconnected. Now don't you think this knowledge, if your daughter is 14-15 years of age, she should know these knowledges. She should have this knowledge. So here's a payment link in the chat box, guys. Just ending in 2 minutes. Right? 5 years old absorbs 60% more radiations. What is the solution? Think. A child, I have done my homework. I'm giving with evidence. A 10-year-old child absorbs 153% more cell phone radiation than an adult. Now just imagine your child is in a smart school. सब कुछ वाईफाई पे होता है. अब आप क्या करोगे? Right? Okay, I have received the payment from Ishwar Thawarani from GPay. Those who are Ria, those who are making payment through GPay na alag se differently ask their email address and phone number, right? Because yeah, Palak Thavrani, right? Palak, you have
Yes,
to
sir.
send me. You have to thank you. Ria. You have to send me your email address and phone number because we have to give you the access manually. EMF exposure is linked to childhood obesity, not just childhood obesity, right? So many diseases: type 1 diabetes, obesity, thalassemia, right? N number of diseases. Wi-Fi can impair the brain function. If you listen from right side, more cancer cells are seen in right side of the brain. If somebody is listening from left side, more cancer cells were seen in the left side, right? So this is what we are going to learn. Now, just hold on a second. Just a second, guys. Perfect. So what we'll be doing next, understand this. Varun, 25 years old, diabetes, gone. Listen what he has to say.
First and foremost, it was something that I also thought was impossible.
Ladies and gentlemen, boys and girls, a very good morning, good evening, good afternoon, whatever time you have right now, which zone you are. So today in Hall of Fame interview, we have a very special guest with us. His name is Varun Bhargav. He's 56 and taking 80 unit insulin. Varun was taking 80 unit insulin per day. And today, Varun is on 16 unit insulin per day, which is a huge improvement.
It was a dream for me also to reduce my medicines. The way that you explained the concepts, it was totally logical with documentary evidence, and that day I was sure that okay, yes, I have found the right person. And thank you so much for that. And you have been true to your words. And it's been now more than a year and a month that I have been following the naturopathy ways that you suggested to me and you told me, and it has been your guidance, and thank you so very much. I've been lucky that I came across you.
So he was able to come from 80 unit insulin to 1616, and today he has gone all, right? So Nidhi Mishra, 21 diseases in one body. We met Nidhi on 6th June, and at that time she was suffering from frequent UTI, right? Counter infection was there, low appetite. She was always feeling bloated, right? And sweating was not coming. Whatever exercise she used to do, no sweating coming. This is not a good sign, right? She used to be very overthinking. She was doing overactive bladder. She just goes to urine, and immediately after minutes, maybe in seconds, she needs to go back again and do the urination. Then hypertension problem, which we have already mentioned, nose bleeding, insomnia, depression, hair fall, mood swings, dry skin, and she just mentioned the wart which just started on her face. Rashes were there, dry eyes, right? Body was paining, all different out of the body was dry, and the most important, mother of all disease, that's constipation. This is gone like this, right? And body heat, and there was a tailbone pain was there. Once we started interacting with Nidhi, we came to know that she's tried everything, all the pathways. She's tried allopathy, homeopathy, Ayurveda, but she was not getting the results. So
rashes and all. So those medicines helped me somewhat. So at
35 tablets in a day she was eating.
That time it became very difficult for me. I was so worried. I cannot even explain you that in my words. I was only having one aim. Even if I don't have anything, let my health be with me. I was so frustrated with this. Somebody told me homeopath has got a very good,
Results.
results. Yes, for this nose bleeding especially.
Yeah.
So I went to homeopath. I started their medicine, and till the time I was taking medicine, I was not having any nose bleeding. But suddenly, my BP was not coming down. The BP was high. So, and luckily that time only I took this course through Insta. I got to know about this, and I just attended it. I was not having any intentions of taking. I was not even aware of naturopathy, to be very frank. And now I feel, why not people in India are not they are not knowing about it.
Naturopathy is the game changer. Narendra Modi ji बोल चुके हैं, right? Let's come and see Tarun Bhargav, 27 kg weight loss and BP medicine gone in 35 hours. Intelligent person, right? See this. So today we have with us a very special guest in our Hall of Fame series. We have with us Mr. Tarun Bhargav, who is 56 and he is 55 and he's from Delhi. We met Tarun first time in May system. He followed the system and he got the results. And if you want to know what results he gained, Tarun has lost 27 kgs and he is absolutely free from hypertension medicine in just 1.5 days.
First of all, I would like to thank you, doctor. You have been a great inspirator and you have actually been my guide.
So this is Tarun Bhargav, Varun Bhargav, sorry. These Tarun and Varun are both our brother. And then we have KVGS Gupta from Indian Army, right? Let's say what he has to say. So today we have a very special guest with us. We have Mr. KVGS Gupta with us, who is from Indian Armed Forces. Indian Army se hai, legs, and he was 102 kg. His height is 5.5 inches, 10 kgs in just 39 days. And he's very active, he's very energetic. So let's come directly to KVGS Gupta.
मैं जुलाई 1 से स्टार्ट किया था सर ये जर्नी। बहुत ही अच्छा रहा। सभी लोग ये खाना ये मत खाना करके ही बोलते थे। ये अंदर जाके क्या होता है मेरे को डाउट था।
राइट।
वो डाउट क्लैरिफाई करने के लिए मेरे को इतना साल लग गया था। वो डाउट आपने क्लैरिफाई कर दिया था। क्लैरिफाई होने के बाद मैंने तुरंत जो
So this is KVGS Gupta losing total weight loss is 42 kgs, right? And I'll show you what Malaika Arora wrote on Twitter. Here is it. Thanks. Vishal Sen is a game changer. Bollywood needs to listen him. 2 years, Jackie Shroff. I was assistant physiotherapist to late Shri Dara Singh ji. I was about to interview him in Doordarshan, but Dara Singh ji हमें छोड़ के चले गए. Rishi Dhawan, he's an IPL player. He plays cricket for Himachal Pradesh. He's Kings 11 IPL खेलते हैं. India, he is represented against Australia, and we have more than 20 IPL players. Rajashri Reddaman, Sukhwinder Baba, he's taking naturopathy guidance from us, right? He is Yuvraj Singh's coach. Sukhwinder Baba, he's Yuvraj Singh's coach, right? So all these case studies, if you see, is actually out of their diseases. They just started their journey from this point. Akshay, type 1 diabetes. He eats mangoes now.
Hey guys, I'm Akshay and I'm a student of Vishal sir in GoNature. So I want to share my experience today. I was a diabetic when I joined the course, and within 24 hours of starting the diet and starting the lifestyle, the CTS diet, everything, my blood sugar came to normal range. My PP was 120 without medicine at that time, and within 24 hours, rather I can say within 2 hours.
Sorry.
Because after eating, but now coming to in the same food diet.
So this is how Akshay from Bangalore, he was able to reverse his type 1 diabetes, right? So endless case studies, endless case studies. I'm going to share my social media link with you guys. If you are interested, you can just go and just subscribe to my Facebook group, Telegram, YouTube, Instagram, LinkedIn, Twitter. So all the links I'm going to give you. Here we go. Please see the chat box. Please go and subscribe. Here we go. Yeah. Any questions? Please write down in the chat box. Any question, please write on the chat box. I'm going to take it. I'm going to take each and every question. How many sessions in a month? So 21st and 22nd October is the high workshop, 2-day wala. Your class is on Saturday morning and Saturday evening. Yeah. For 13 months, yes, continuously for 13 months. If there is any holiday or something like that, that's exceptional. So I'll let you know if there is any holiday, but I come live Saturdays, morning and Saturday evening. My mother is diabetic. Will she be able to come out of diabetes? See, 3 things will happen. Relief, reverse, cure. We cannot use the word cure for diabetes. आप बोलोगे जेल हो जाएगा. कोई भी बोलेगा reverse is the word. So what is relief? Relief means your mother was taking 5 tablets. Now she came down to 2 tablets. It's a big relief, right? Reverse means by the time you're following the diet plan, things are okay. The moment you do a little cheat on something, the glucose rises. That's reverse. So, and cure means आप कुछ भी खा रहे हो, and okay, in starting you did the diet, but after 4, 5, 6 months you eat sometimes chole, bhature and samosa, but still the glucose is not coming high. I think that should be used as cure, but we cannot use the word cure. Now it depends how much damage your mother has done by eating medicines. Getting my point? How much damage your mother has done by eating medicines, it will decide whether it should be reverse or relief, reverse, or the other category. My knee is very bad. It has cyst. Cyst is overgrowth. So IGF formula लगा हुआ है आपकी बॉडी में, extra IGF बन रहा है, and it has given you cyst. Cyst is overgrowth. As mornings, I need to send kids to school. So 7 a.m. is the session on Saturdays. A lot of mother come. If you miss, you get the recordings. So I'll show you exactly how the recording will look like. This is when you make the payment, you will receive this course. And here is the morning sessions, right? These are the morning sessions. So when you click on this, you will get the entire, all the morning sessions would be put over here. All the morning sessions you can see, you will be seeing over here, right? All the morning sessions put over here. कोई भी एक आपको सारा नहीं देखना है, सिर्फ एक देखना है. I am repeating, everybody, you just have to watch any one. I don't have to see all. Or even if you don't watch it, absolutely fine, because we'll be doing it live on 7th. That. So I want you to just relax, sit down, no meet life's challenges. Before we start, take a full breath in. On a positive. So I wanted to show you how one of my students was able to hold his breath for 10 minutes. Really amazing, Praveen. More power to you. So Praveen Kulkarni is from Pune. He's in IBM, and he was able to hold his breath for 10 minutes. So this is on 7th. We will learn this. आपका mind घूम जाएगा कि भाई how is this possible? How somebody can hold his breath for 10 minutes, right? Amazing. 5 minutes are like normal. 8 minutes 45 seconds. 8 minutes 45 seconds. This is live training. You can do it, Praveen. Well done. Alternative Saturday, but usually it's like sometimes because it's 9 minutes. High workshop happens on Saturday, Sunday. जैसे अभी 21st and 22nd is Saturday, so that 55 second left. That Saturday it will not happen. If you're not, Meenakshi, if you're not available on 21st and 22nd, then you can come in the November batch. You can come in the December batch also. So this guy is the first student. 9 minutes 30 seconds. Was able to hold his breath for 10 minutes. His name is Praveen. He's in the community. Yes. 9 minutes 50 seconds. Yes, yes. Autoimmune disorder can be addressed. 10 minutes. The first student to reach 10 minutes is in front of you guys. Well done, Praveen. You are in a different state. Yes, Meenakshi. You will get all the information through email, WhatsApp. Amazing. Amazing, amazing. Relax, relax. Guys, just type wow in the chat box. Yeah, just type wow in the chat box. 10 bloody minutes. Wow. How many of you want to learn this? Relax, relax. He says, take your time, take your time. He has been with me for 2 years now. He says, Vishal, I look 20 years younger. Everything is possible, guys. 10 minutes, Great. Amazing, amazing. Yeah. So here's the link. Ria, you can make it 5999 now manually. Please make the link 5999 manually. Yeah. Thank you. So let's go, guys, and let's take more questions. Autoimmune can be reversed without any supplements. Yeah, supplement is a disease. Autoimmune disorder क्यों होता है? Means your what is autoimmune disorder? Your body is unable to distinguish between friend and an enemy. वो दोस्त को भी मार रहा है, दुश्मन को भी मार रहा है. That is autoimmune disorder. How it happens? What if we go to the root cause of this? And then comes the solution. Supplement is not the solution. It's an industry. खाते रहो. I've eaten for 6-7 years. Yeah. Okay. Any more questions, guys? Great. So note down this email address. Any problem in future, connect @GoNatureClassrooms.org. This is the email address. Okay. Phone number. इधर देखिए. विनम्र विनती है, nobody will call on this phone number. We have given you this phone number because we will send you a WhatsApp message from this number. Anybody calling us, we will not pick. Because this phone number is with like almost 4.5 lakh people. I want you to save this number to receive the WhatsApp messages. Ria or Jyoti are here. They are the coaches with GoNature. They are going to help you in that. Right? Any problem, just email us at connect@gonatureclassroom.org. Join the WhatsApp group and the Telegram group. That's it. Sorted. Abhi jao, so jao. 7th we are meeting, guys. That's it. You will learn the secrets nobody's teaching. You will learn the secrets that is not in school, colleges, and even university, even medical college. You will learn to go back to become a Rishi Muni in your home, holding your breath for 5 minutes, maybe 10 minutes, and reversing your diseases. Right? Yeah. My outer knee is pain. Can you please tell me the reason? I don't know what is the reason. I need to introspect it. But the reason will come out if you attend these classes. So if you have taken this course, you have done the best decision. You will find out the main reason of the pain. Got it? Chalo. Sorted? Any more questions left? Okay. Please join Telegram group and WhatsApp group. Please join Telegram group and WhatsApp group. Please watch. If you want to watch, you can watch this recording. Otherwise, it's not required. Right? If you want to make money sitting in your home, then there is one more course, affiliate program course. Go and watch. This is a 55-minute course. How to start making money online by promoting our free webinars. Right? If you want to, it's not compulsory. This is all the recording of morning session. If you missed, you can watch here. This is the evening sessions in which I take questions. And this is affiliate program. That's it. And all other training is pure life. Okay. Thank you. So I'll take your permission now. Please note down the phone number and the email. Can diabetic retinopathy be cured? It can be reversed. Retinopathy. Right? उसके बाद क्या आएगा? Diabetic foot ulcer. जख्म आ गया, भर ही नहीं रहा. What is the root cause? I'll tell you the mechanism of cancer and retinopathy is same. ये कैसे possible है? In the Hive workshop, day 2, we will learn this only. Right? WhatsApp link, please. All the paid members, the moment you will make the payment, the email address you have used for the payment, in that email address, an email will come. Go and check it out. Join the WhatsApp group, join the Telegram group. If not received, check your spam. फिर भी नहीं मिलता है, धीरज रखिएगा, शांति रखिएगा. Tomorrow WhatsApp message will come you from this number we have given you, 7060026255. A WhatsApp message will also come. Okay. Pooja Verma, Shweta, I have paid. Did you receive? Shweta, please drop your email address and phone number from which you have paid. My team will connect with you. Total 45 payments received. Thank you so much, guys. You have made the best decision of your life. You have no idea. This 200 rupees per month subscription will take you where. You have no idea. Not just you, just family members. You'll thank me later, right? And I'll be happy receiving your love. Quickly ask any questions, guys. Any more questions? Okay, so Ria Jyoti, sorted.
Yes, sir.
ठीक है.
Sir.
Perfect, perfect. Chalo. So let's close. Let's close the deal. Make it 5,999. Thank you very much, guys, for being here. You have made the bestest decision of your life. I repeat, you have made the bestest decision of your life. When you see it, after 21st and 22, these radiations will not harm you or your family members. चाहे घर के बाहर टावर आ जाए, mobile, internet, Wi-Fi, anything, it will not going to harm you. Right? Now, I'm sharing the Telegram group link with you. Please join that Telegram group, because in that Telegram group, I'm going to share the two remaining this bonuses. Okay. So here is the link in the chat box, guys. Please go, click on this, join, right? And you will receive the two bonuses tomorrow: 20 incompatible food risks and 5 animals like habit, right? Those who are on the edge, let me tell you, you have eaten a lot of junk food of 26,000 rupees. Give yourself a push कि नहीं यार करते हैं, नेचुरोपैथी सीखते हैं ये सब, and you will be shocked to see that you're not actually harming yourself, you're actually dangerously, you are making your lifespan small. तो उसको कैसे हेल्थ